I think we're live.
Okay.
Live? Maybe. Looks like we are. Should we start?
Sure.
Hey, everyone. Welcome back to the channel. Today we've got a real treat, which is another Q&A session with the brilliant Dr. Peter Rogers. If you've seen Peter's previous talks, you already know that he's got one of the sharpest minds in medicine. He's a machine when it comes to reading and retaining information, medical studies, clinical observations, history, biochemistry, toxicology, you name it. What makes Peter especially unique is his ability to see patterns across disciplines and synthesize them into clear, actionable insights. You know, whether we're talking about diet, optimal health habits, or avoiding the everyday toxins that most people don't even think about, Peter sees it, he connects the dots, and he explains it in a way that just makes sense. And before we dive in, I should mention that I'm in Mexico right now, so the quality, whatever, my picture doesn't look the same. We just got here yesterday. I'm staying in a little town called Bucerías, which is this beautiful little beach town on the Pacific coast. In fact, here, I'm going to show you what we're looking at, which is, this is my view out here. That's the Pacific right out there, where people are kite surfing when the wind comes up, and it's a really nice place to spend some time. All right, so let's get back to this. Now that we've got that out of the way, we've got a lot of questions today, and Peter and I were talking about, we're just gonna kind of rush through the ones that we think are maybe not as interesting to more people so that we can get to as many as possible. We don't want to get hung up on ones that are not sort of universal in a sense. Peter, you ready to go?
Yeah.
Always ready to go. All right, let me go here. Here's the first question. Please rank the elements of the Spartan diet by degree of harm reduction, e.g. 1, eat starch, 2, filter water, 3, low fat, 4, low sodium, 5, low protein, 6, organic, 7, microplastic avoidance, 8, estrogenic avoidance. So, whoops, there's a little more there.
I would say probably number 1 is be 100% vegan. Once you get rid of the animal foods, that's a giant transition, both for your health and psychologically. Number 2 should be low-fat, plant-based foods, single ingredient. Number 3, to filter your water. There's a lot more stuff in the water than people realize that's bad for your health, from the F- fluoride to the aluminum, the excessive amounts of chlorine, all the estrogenic chemicals, and other things that are in that water. So those would be, I'd say, the highest priorities.
Great. What do you suggest on how to clean your blood after taking the flu pneumonia shots?
Well, I don't know for sure about that. All the general health stuff can be helpful. I don't know if therapeutic phlebotomy might be beneficial. For a lot of people, I think therapeutic phlebotomy is beneficial. And the reason is it's good to have a lower serum ferritin, okay? And then what I also ask myself about is, why do people die? The main reason people die is because of blood vessel clots. A clot in your heart, it's a heart attack, most common cause of death. A clot in your brain is a stroke. But little clots in your heart, atrial fibrillation, congestive heart failure, that start pushing you towards death. And, ischemia due to atherosclerosis, narrowing and occlusions is a predisposition to the Warburg effect in cancer. So you want to have good blood flow. That's actually a good way to think of almost all diseases. Everything in your body works better with good blood flow. So ask yourself, how can I get that? And the way you get that is low fat, low sodium, 100% vegan, single ingredient only, organic only if possible, no oil, no alcohol, no caffeine. That's the healthiest diet, and that gets your immune system to work better too.
Great. Next question. Dr. Rogers, quite a find. Why a low-fat vegan diet helps osteoarthritis?
Well, number 1, it's going to help optimize your body weight. The lower the percentage of calories you eat from fat, the skinnier you become. Also, when you start eating low-fat vegan, you kind of, almost all the good stuff is in the plant foods. That includes the potassium, the magnesium, the plant nitrates for better blood flow, and then the fiber protects you from leaky gut, and it maintains your blood-brain barrier. This also protects your joints from inflammation. So you get skinnier and you minimize joint inflammation. And when you do all that, quite often arthritis will improve. Osteoarthritis isn't purely wear and tear. Dr. McDougall made the interesting comment. He wrote a great essay called "The Only Hope for Arthritis is Diet." And one of the things that he points out is in the countries where they eat a Western diet, even the people who don't do any physical labor get DJD, okay? And then when you go to the manual labor countries, these third world countries where people are working their tails off physically, they don't get that, hardly any DJD. It's degenerative joint disease and osteoarthritis are the same thing, but they don't get it despite extensive physical activity. So the point being is it's much more due to diet than is widely realized. And, you know, there's a component that's irreversible. When you've got bone on bone, subchondral sclerosis, subchondral cysts, that's not going to go away. However, the acute inflammation like of the nerves, when a nerve has better blood supply to it, it will have less pain. There's lots of people, for example, that reverse diabetic neuropathy and decrease compressive neuropathies by having better blood flow to the tissues.
Great. Looking for recommendation for dry skin, especially for seniors. You've been warning about oil being absorbed by the skin. I currently use organic rosehip oil for face, organic MCT oil. Rest of my body's a concern for me. If so, what are your suggestions? I'm already following your low fat, low protein, high carb.
Yeah, I would say number one, try not to wash so much. I'll just tell you a story. You know, back around the 1990s, I was an imaging guided surgeon. And everyone was a little bit freaked out about AIDS. And I did tons of procedures on HIV and hepatitis patients. And I would wash my hands after every case. And my skin started becoming dried out and a little bit thinned. And my wife, and then I noticed a lot of the techs almost never wash their hands. They just rinse them off. And it's funny, my wife says to me, she goes, "You think you're so smart? You're washing off all your skin barrier. You're going to get one of these HIV or hepatitis diseases. You're such a hypochondriac." Okay. And I looked at the techs, they had robust skin, they're all healthy. And so anyways, I would rinse my hands off. I would avoid excessive washing. I would wear gloves before and after things so I wouldn't have to wash my hands so much, and the problem went away from me. So excessive washing can do it. Harsh soaps can do it. Using water that's too hot will dry out your skins. You can look into the moisturizers, but you have to be careful because most of them contain a whole bunch of estrogenic chemicals. Our skin is like lipid. You know, we can swim in the water and we don't quickly become waterlogged because in, you know, chemistry, like dissolves like. And our skin being lipid, it keeps the water out. But if you put these lipid moisturizers on yourself, lipid means fat, there's a tendency for a significant amount of that to become bioabsorbed. So I would certainly try to minimize your exposure to estrogenic chemicals if you absolutely insist on using one of those things. And being hydrated helps to decrease dry skin.
Can narcolepsy also be caused by leaky gut?
Well, I've seen that there are some papers saying they're associated, but, you know, what I would focus on doing is preventing the leaky gut, which comes from eating the high fiber diet and avoiding all the things that cause leaky gut. You know, the fluoride, the aluminum, the alcohol, the emulsifiers in processed food, all the vegetable oils, all that sort of stuff. Carrageenan.
Thoughts are critical in disease. That's why they are considered first nutrient in human nutrition spectrum next to impressions, emotions, and air prana. I've been reading multiple sources and theories all over the world, made connections and some humble predictions, but Rogers and Nelson altruistic informational job was something I did not see coming. Very grateful for your contributions. To the pros, we shall put ourselves in our brothers' shoes to understand beyond the roofs, which we were born to remain one culture, not touching others, to say self-trapped and boring, limiting, indifferent.
Well, I would actually say Jeff and I do have a big advantage over most nutrition persons. We're doing this because we want to do something good, because we want to help people. So we don't have to sell you the latest whiz bang, whatever it is. So anyways.
Great. So next is, what are your thoughts on drinking colloidal silver? How do you recommend to treat Helicobacter pylori? What do you recommend for dry skin? It's fresh.
Okay, we already talked about dry skin. Thoughts on drinking colloidal silver? I don't see any reason why you would want to do that. I'd be worried about that causing side effects and problems. I'm not aware of any benefit for it. What do you recommend best for Helicobacter pylori? Dr. McDougall has a good newsletter about, you know, my stomach's on fire. And what I basically say is, you know, just being healthy, you minimize the likelihood. Lots of people have asymptomatic Helicobacter pylori. So by eating the healthy diet, living the healthy lifestyle, no tobacco, no alcohol, get your sleep, manage your stress and all that, eat the low-fat vegan diet, most likely your Helicobacter pylori will not be symptomatic. If worse comes to worse and you're still dramatically symptomatic and even go down the path getting endoscopy and they confirm H. pylori, you could take the like triple antibiotic therapy, but you know, again, there's a good chance you could just manage it without that, and that's what I would try to do first.
Great. Water filters are commonly recommended. Can Dr. Rogers talk a bit about water filter types? Also, the concern of microplastics is one to do when pretty much all water filters are made of plastics.
Yeah, well, a lot of times they're made so that you don't get plastic. You have another carbon filter after the reverse osmosis unit. So you'll have initial carbon filters, then you'll have a reverse osmosis, and then there'll be another carbon filter right there. If you got one that are on the countertop, you can have it stored in glass, or just get the best plastic you could get. It's hard to get perfection. A harder plastic isn't going to leach as much. I like having a whole house carbon filter because that gets rid of the estrogenics, gets rid of the chlorine. Ideally, it's nice to have a reverse osmosis in the kitchen. You can get distilled, but distills are kind of cumbersome and they take more time to work. Also, you got to be aware when you drop the osmolality of water, the more you filter water, typically it becomes slightly more acidic and it can become almost too hypoosmolar. Like you wouldn't want to give a child or a baby a big thing of water that was distilled. It's too hypoosmolar, meaning that there's no particles in it. And so you could do things like squeeze a lemon or a lime in there or something else to add some particles to it. What I always do is I'm always eating first, and I almost never drink water because, I drink water after I guzzle down, let's say, 32 ounces of beet juice before working out or before giving a talk or something like that. But plant foods are so full of water that you often don't need to drink much water. So anyways, yeah, that's what I'd recommend. You can ion exchange filters are getting better, but I don't have experience with them.
Is nutritional yeast healthy? Never heard you mention it before.
Yeah, I've read that it can contain MSG, so I wouldn't like it. And MSG is an excitotoxin. I'm not aware of there being any benefit to it, so I would avoid it.
No. It's also calorie dense. What kind of toothpaste, general hygiene products do you use? Also dishwashing and laundry detergents. I
use as few personal care products as you possibly could. I am totally a minimalist. I believe we'd be best off living like Adam and Eve, except keeping our indoor heating and plumbing. You don't need laundry detergent. I just put my stuff there, keep the water relatively warm. If I think it's a little dirty, I'll run an extra cycle. Because laundry detergent itself is intrinsically estrogenic, typically something like nonoxynol 9, and then it also comes in a BPA plastic bottle typically, or a BPA substitute, BPS or something, and then there's conditioning plastics on there like phthalates. So you got 3 estrogens right there if you're pouring liquid detergent into your laundry. And then those little softener squares to prevent wrinklers in the dryer, those things also have estrogenic chemicals. So you get all that stuff on your skin, and then it's leaching from your clothing into your skin all day long. And you don't even get the first pass liver effect. If you drink something absorbed through the portal vein, goes to the liver, that'll remove a lot of the estrogenics. But when it's on your skin, it just goes straight into your skin all day long. It's easily avoidable. I haven't had a problem. I've done that for decades and decades. If you're not cooking with oil, then you don't need dishwasher. You don't need to use a dishwasher, and you don't need any soap. Okay, it's the oil that makes everything a big sticky mess. So you avoid those two. I don't put any personal care products on. Like I said, I don't use perfume, cologne, any of that stuff. If you like somebody well enough to get that close to them that you can smell them that well, you don't need anything, okay? The other thing I'm joking, I think deodorant is stupid. When you walk in the door, you say, hey, how you doing? You don't sniff each other's armpits like a dog, okay? We talked about deodorants increasing the risk of breast cancer, upper outer quadrant going from 25% to 30% since the 1920s. And they think it's because of shared lymphatics with the deodorants containing methylparaben estrogenics and the aluminum's metalloestrogen. So I recommend avoid personal care products as much as you can. Almost all of them are unnecessary.
Great. The one-a-day vitamin mineral supplement, perhaps not necessary, but can it be harmful?
I think vitamins are often kind of stupid. And the reason I say that is they very often contain fake ingredients, like the wrong version of so-called vitamin E. And they also often will contain iron, which you don't want, or increased amounts of copper or something else. Plant foods are very nutrient dense. So unless you have some special unusual situation, I would recommend not taking them. And I would take maybe only the thing that you're deficient in. The only supplement I take is vitamin B12, methylcobalamin type.
Great. So can you weigh in on the vinegar trap that is recommended by Dr. Greger and the Queen's Chef AJ Mrs. Esselstyn, the metabolic crisis that is formed anytime highly acidic substances that do not have their own buffering agents, force the body to leach calcium from bones and teeth to buffer, and in combination with salt is a double whammy to the zeta potential and hydration of cells. Fresh citrus still contains all its own buffering compounds, make it alkaline, the body correct. Alcohol has been proven to cause cancer. Why do we consider its cousin vinegar to be better for human tissue than alcohol?
Okay, yeah, that's a pretty big question. So a couple thoughts here. So what they're talking about is Dr. Esselstyn recommends this is for his most severe coronary artery disease patients who he thinks are very high risk for having a heart attack, and to try to turn them around a little more quickly. He recommends they eat greens 6 times a day. He often steams those greens, and he says if you put a drop of vinegar on them, that helps activate nitric oxide producing enzymes by doing that. Okay, there's something called the nitrate cycle. When you eat greens, they enter your mouth as nitrates. That's NO3, 3 oxygens. Then on the back of the tongue, there's bacteria that convert them to NO2. That's nitrites. And then the nitrites go down into your stomach, and the stomach acid helps convert those to nitric oxide. And then that nitric oxide is absorbed into your blood. It goes all over your body and causes systemic vasodilation, opening up of arteries. And that's why Esselstyn is recommending it, because as a person gets older, their endothelial cells, the lining cells of the arteries, produce less nitric oxide. So he's saying this is a way you can keep your nitric oxide levels higher systemically. Systemically means throughout the body. So you could make the argument you could eat greens, and you have to chew them, because if you chew them, then they sit around, they get more contact time with your tongue, for example, to get that conversion step from nitrate to nitrite. And this is in contradiction to if you were like to guzzle down a smoothie of greens, they're not going to contact the back of your tongue for long enough time to get significantly converted to nitrites. So that's the downside of going down that path. And I would say, too, you'd be just eating the greens alone, you'd be okay. They're not going to affect your teeth. But if you're eating some sweet foods and then you eat the greens on top of them, you could have a little bit of a problem with your teeth. And then somebody said, well, what about the vinegar? I'm not that big a fan of vinegar itself. It's like acetic acid is the other name for vinegar. You know, that's like ethanoic acid, 2 carbons with a carboxylic acid on it. So it's not the greatest chemical in the world, and it often has a sulfite as a preservative. Sulfite's a little bit of a mild excitotoxin, increases calcium entry into brain cells. So, if there's such a tiny amount, it's not that big of a deal, but I'm not a big fan of it. If I had a choice, I wouldn't seek it out. I'd put it that way. And this is really especially for sort of end-stage cardiac patients. That's pretty inconvenient for a regular person, to be eating greens 6 times a day. But if you're close to death's door and you got to turn it around, then I could see your rationale for it.
Great. So I have high eye pressure, 28 to 34. At 26 years old, I'm very fit with normal blood pressure. I eat Dr. Greger daily dozen, just 1/4 cup of walnuts and a tablespoon of ground flax seeds for fat. My doctor wants to put me on eye pressure lowering drops. Any suggestions? My mom has always had high eye pressure, but it's never caused her optic nerve damage. Okay, so upper limits of normal intraocular pressure is about 20. Person's a little bit high. A lot of times that's associated with hypertension. So if you can control your blood pressure better, that might control your eye pressure. If it's only in one eye, you could sleep with that eye higher. That lowers the intraocular pressure a little bit while you're sleeping. What lowers blood pressure? The main cause of blood pressure is high-fat diet. Sticks the red blood cells together. Rouleau formation, blood sludge. Okay, so minimize dietary fat. The way you minimize dietary fat, white rice, potatoes, sweet potatoes all have 1% of calories from fat. So that's an easy way to do it. Lowest percent of calories from fat with beans is lentils at 3%. Okay, fruits tend to have low amounts of fat. So anyways, those are ways to minimize your dietary fat. Minimize your dietary sodium. The catch with sodium and blood pressure is that it's all really the ratio. The key is to have much, much more potassium than sodium. Our ancestors probably ate about 16 to 20 times more potassium than sodium. These plant foods, though, if you're eating a lot of plant foods and you start looking at the labels, you'll see very often they have 100, even 200 times more potassium than sodium. So just eating plant-based diet tends to dramatically increase your K factor. K factor is the ratio of potassium to sodium, and that'll bring down your blood pressure. The other thing a lot of people don't think about is the component related to leaky gut for high blood pressure. You want to eat plenty of dietary fiber and avoid all those things I mentioned earlier, talking about water filters and leaky gut, because leaky gut increases high blood pressure. It increases high blood pressure because, number one, you get the bacterial endotoxins getting across the leaky gut where there's a lack of tight junctions, because you need the fiber feeds the good bacteria, and the good bacteria take the fiber and they make it into butyrate, a 4-carbon short-chain fatty acid.
It's like a butane with the carboxylic acid on it, butanoic acid. And that then is used by the lining cells of the gut, the enterocytes, to make tight junctions. Those tight junctions keep the bad stuff from getting across the gut barrier. When I say bad stuff, I mean like bacterial endotoxins, LPS for gram-negative bacteria, LTA, lipoteichoic acid for gram-positive bacteria. Those get into the blood, and they catalyze a very rapid amyloid transformation of the clotting protein fibrinogen. It changes from an alpha helix, secondary protein structure. You see this in any biochemistry book. Secondary protein structure, alpha helix, the beta-pleated sheet, where they flatten out. And then they form hydrogen bonds between the individual beta-pleated sheets. So they're all connected. They stack up. The larger the molecular weight of a molecule in aqueous solution, water, like the human body, the more likely it is to precipitate. To precipitate in blood means to clot. So you start forming these amyloid clots. A regular clot with fibrinogen, for example, is going to look like pieces of spaghetti wrapped around red blood cells. However, when you have an amyloid clot just means there's a change in the secondary protein structure. It's more of what is called a dense matted deposit. It's highly irregular. And the significance is it's harder for the body to lyse that. So they're refractory to lysis, these amyloid clots. And people with leaky gut form a lot of these. And they sort of just float all over the body. And they can plug up capillaries in your brain, lowering cognitive function. They can plug up arteries in your heart, increasing your risk of atrial fibrillation, congestive heart failure. So you really don't want leaky gut. And you just get a generalized increase in systemic inflammation when you eat a lot of meat and processed foods. And that'll cause an elevation in your white blood cell count. Meat eaters, processed food eaters have higher white blood cell counts anytime you just do a random blood draw on them. And the relevance of that is typical capillary is only about 5 microns. That's a number worth remembering. 5 microns is your capillaries. Your red blood cells are about 7 microns, okay? Now, when you talk about the most common white blood cell, that's a neutrophil, and that's 14 microns, twice the size of a red blood cell. So your pressure is going to go up because you have to pump all of these big cells through your capillaries. Normally, over 99% of the blood cells in your blood are red blood cells. So that's the most important thing, your hematocrit, okay? But elevated white blood cells do contribute to higher blood pressure. And sometimes even when they're inflamed because there's too much endotoxins in the blood, you'll get more activation of the neutrophils, and they'll even sometimes undergo something called netosis. NET means neutrophil extracellular traps, where they're releasing their DNA. They're in a sense committing suicide when they think they're fighting an infection. And that will raise blood pressure. We don't have time to get into netosis, but you can look it up very easily. NET-osis. NET is neutrophil extracellular traps. Okay, that contributes to high blood pressure. Other things that contribute to high blood pressure is psychological stress. Okay, that increases cortisol and catecholamines. And then there's stress equivalents. Caffeine increases the same hormones. The catecholamines are adrenaline and noradrenaline. They cause vasoconstriction. Cortisol pulls fat into the blood, pulls glucose into the blood. By pulling glucose into the blood and the fat, it causes insulin resistance, so it increases your risk of diabetes. Sleep deprivation raises the exact same hormone. So you can get yourself into a vicious cycle with these things. And that's why I recommend no caffeine, try to get your sleep, etc. Okay, so those are things you can do to control your blood pressure. And in so doing, you'll potentially be able to drop your intraocular eye pressure, and then you see if any of the other things help, raising the head of the bed a little bit and whatnot. You can try that sort of thing. If you're using contact lotions, make sure there's not some chemical in there that's hurting your eyes, that sort of thing.
Great. I don't see any harm in losing the walnuts and the flaxseed oil myself, or the flax seeds myself. But anyhow, here's the next.
Oh yeah, I didn't recall that from the question. Yeah, I wouldn't eat that stuff. I don't eat walnuts. I think flax is totally overrated.
I'm 76. I've been on McDougall diet for around 5 years. Was plant-based for 25 years. Exercise daily, but blood pressure high around 155/95. Remember, McDougall used to say it's old scars and the vessels that remain. Dr. McDougall also generally advised against medication. I would love to know what you and Dr. Rogers think.
Yeah, I just kind of went through that, all the stuff about hypertension. The key is that K-factor ratio. Our ancestors were made to have 15 to 20 times more potassium. Unless you're in kidney failure, about to go on dialysis or something, we're made to have 15 to 20 times. The typical American eats about 0.4, meaning they eat 2.5 times more sodium than potassium. Burkett said we're the only animal that eats more sodium than potassium. So anyways, those are things you can do to improve your blood pressure.
Great. And I would not go on blood pressure medication at 155. Anyhow, my question, would you know if anyone has had improvement with fatigue and nausea plus lowering high white blood cells, high lymphocytes because of CLL?
Okay, now that's complicated because I don't know how much the elevation in white blood cells are due to chronic lymphocytic leukemia. Okay, I gave you all the things we can talk about handling blood pressure, but that's the kind of thing. CLL is a little bit of an unusual disease. Some patients have a real mild version of CLL. Nobody does anything, and they can live for a long time with that. More serious CLL, they start treating them with all the cancer chemotherapy type stuff. Dr. McDougall had a very interesting lecture about lymphoma, the Alan Cunningham theory from 1975 about eating a lot of meat, overstimulating the immune system, and then some lymph nodes go out of control from the overstimulation and become a lymphoma. So that's another reason to go low-fat vegan, but that's as far as I can answer that question.
Okay. Next, Peter, I live mostly barefoot on a tropical island. What can you tell us about needing to do a parasite cleanse? What parasite protocol would you recommend?
Yeah, I don't have any experience with parasite cleanse.
Yeah. Next, could you set up a debate about fat, no fat, Dr. Matthew Nagra versus Dr. Peter Rogers or versus Dr. Cavallo?
I'm happy to talk to them if they want to talk to me.
Yeah. I don't think it's necessary, but anyhow. Next question. Went low-fat vegan 3 months ago. The weight dropped quickly, up the starches considerably, but weight keeps dropping. Now experiencing uncomfortably full feeling after every meal, snacking constantly, but still losing weight. How do I make it stop? McDougall said, slowly add sugar, protein, then fat. That seems regressive. What do you recommend?
Well, it's an unusual problem that a person just keeps losing and losing weight. You do get skinnier. Okay, a couple things. Number one, you can eat foods that have a higher percentage of calories from fat. Like we talked about white rice, sweet potatoes only 1% of calories from fat, lentils 3% of calories from fat. You can eat garbanzo beans, 13% of calories from fat. You can eat oatmeal and quinoa, in the ballpark of 15% of calories from fat. Those are still pretty reasonable plant starches to satisfy your hunger. Fruits tend to be very low in fat, and you kind of do the opposite of what you do when you're trying to lose weight. So eat the starches first, eat as much as you want. That's a reasonable way to go. You're probably better. What I've also noticed with fruits, it's easy to overeat fruits. I know there's a lot of people on the internet saying, they lose weight on fruits, but I don't know about you. For me, I could eat fruits, till the cows come home. It's like your hunger satisfaction doesn't set in that quickly. And then that gets into all the fructose metabolism stuff, which is a big other subject. But those are things you can do. I know for myself, I start putting on weight if I eat tons of fruit.
Yeah, I'd say dried fruit would be good, and because that's particularly calorie dense. Cereal, look at some cereal, something like that. That'll do it. Here we go. Why do some people decline on a whole food plant-based diet and thrive long-term on a more carnivore diet? Okay, we're getting a little trolling here. While other people decline on a carnivore diet, thrive long-term on whole food.
Yeah, it sounds like that troll sophistry.
Yeah. Okay, let's just move on. Thoughts on how to heal PCOS?
Okay. Yeah. Well, basically, polycystic ovary syndrome, usually and I'll just share with you, Dr. McDougall one time said, if somebody told me they had earwax, I would tell them to eat a low-fat, plant-based diet. And what I'm saying is that's a good concept to get, is that your body always wants to heal. So just give it what it needs to do its job. And that's, the low-fat, low-sodium, 100% plant-based diet with no oil, no alcohol, no tobacco, no MJ, et cetera. And the body will tend to fix most of its problems. And also, if you get as healthy as you could be, because I know a lot of people, they go halfway on things. I think that's a big mistake. The older you get, the more fragile you get. And you also want to have built up some physiologic reserve. You fall down, you just catch yourself, you're okay. Whereas a fragile old person falls down, they'll fracture a wrist, fracture a hip or something. So I think that's the same thing with a lot of these diseases. Make your body as healthy as you could make it. Do everything right you can. And quite often, problems just fix themselves. Like when I switched to becoming a vegetarian, this was many, many years ago, my back pain went away. My foot little aches and pains all went away. A lot of things improved.
Amen. Okay, what are your thoughts on fructose as a driver for metabolic syndrome, as suggested by Dr. Richard Johnson, whoever that is? He also links excess fructose to Alzheimer's.
Okay, so I have read Richard Johnson's books. I have also read Robert Lustig's books. I have seen their lectures, and they're part of the camp that tries to say fructose is a terrible thing. Fructose is a poison. The purpose of fructose is so a bear or some other animal can eat lots of fruits at the end of the autumn season and fatten themselves up and survive the winter, okay? And it is true there are some fructose pathways, especially if you're eating high fructose corn syrup in the setting of processed food with no fiber, that do increase the risk of getting a fatty liver. But there is another side to it. I think they kind of dramatically downplay the fact that fructose, not all of it is made into liver fat, and it can be interconverted, in part to glucose. I'll just give you a suggestion. If you want to see a more balanced point of view on fructose, after you've seen the Richard Johnson and the Robert Lustig perspective, check out the Jay Feldman Wellness Seminar Biochemistry Lecture on fructose. I think you'll find it really interesting. Because I think fruits are a pretty good food, but I wouldn't eat anything with high fructose corn syrup in it. It often has mercury in it too, because pouring it through a chloralkali vat and processing.
Sounds interesting. I'm going to check that out. Thank you, Peter. Okay, should I avoid calcium chloride in processed foods? Dr. Eslin's 6 meals of leafy greens proven to work, or is it? Dr. Dean Ornish doesn't do this and gets good results. Is it worth the hassle?
Okay, well, that's a couple questions. First of all, I won't eat anything that's got more than one ingredient. If there's more than one ingredient, they could add MSG, MFG, or other things and not have to tell you. So I only eat single ingredient foods, whole foods. So I wouldn't eat anything with calcium chloride added to it. And I definitely wouldn't supplement with calcium either. I think that's an unhealthy thing to do. Okay, we already talked about Ornish's 6 leafy greens.
Yeah. Next question. Dr. Rogers, what are your thoughts about so many people lately coming out on YouTube and talking about the sugar diet, fruit juice, refined sugar, veggies with no fat, very low protein, having amazing results with weight loss and getting ripped, super energy, athletic performance? Is this a commercial? Some are saying you could eat fruits, protein, or starch at dinner, but the weight loss is faster without it. I'm waiting for the
Okay. Sugar. I'm smiling here because there is something funny going on in the internet. There's this hot meme for the sugar diet, and the guy who's promoting it right now is funny. His name is Cole Robinson. And when you see him talk, he's always yelling and screaming, and he's hyper emotional. But when he talks, he's kind of captivating. He's kind of fun to watch. He almost reminded me of like the Eminem of the sugar diet. Like, one day my kid was listening to that Eminem rapper music, and I'm like, turn that crap off. If Van Gogh had to hear that, he would have cut off his other ear. And my kid's like, no, Dad, Eminem's a genius. And I'm like, don't kid yourself. So then I looked up Eminem's poetry, and Eminem actually is an idiot savant genius at writing rap poetry. It is actually extraordinarily sophisticated and good. Other than that, though, he's kind of crazy. And this guy's kind of like that, too. He's funny to watch, Cole Robinson. And then he had an interview, like an hour-long interview with Mark Bell, who's this power lifter, weightlifter. And he's a nice guy. I like Mark Bell. I was into weightlifting, and I've watched these things. And it kind of reminded me of Beavis and Butthead. They're nonstop swearing, and then they're saying all these things that are completely ridiculous. They're saying, yes, you need to lower your fat, so you should eat lean meat. All meat is high in fat. About the leanest you're going to go is about 25% fat. So the whole thing was kind of nonsensical and funny, but I thought they were nice. I liked them, and they were entertaining, but I didn't think their nutrition information was too good. Okay, then somebody else will say, well, what else? Well, add a little bit more to that that's useful. I decided I would try it out yesterday. I had to go for a workout, right? So when I want to have a good workout, I'll sometimes drink beet juice before I work out because that's got a lot of plant nitrates, elevates your blood glucose, hydrates you, et cetera. And I know my maximum sets have always been when I've had the beet juice for when I'm doing high repetition squats, for example. Okay. And what I'm trying to say is I put 15 teaspoons of sugar, organic sugar. It was actually brown sugar because that's the only thing that was available to me. And it made zero difference. I drank it 2 hours before my workout because I wanted to, give it time for the blood glucose levels to get elevated. It made zero difference in my workout. I was lifting weights and pushing myself to the max. It made none whatsoever. Because there's other guys on the internet like Durian Ryder, and he says sugar is the best supplement in the world for your energy and for your Johnson and all this stuff. There's a lot of hype. And then the other thing is my tooth. I have a little like old small cavity that usually doesn't bother me, but it's been sort of aching ever since yesterday afternoon when I did that. So I'm not going to do it again. I think a lot of people have dental problems. I see tons of patients that, are missing multiple teeth. So I'm not too enthusiastic about this. Plus sucrose, like table sugar, white sugar, it's a combination, half and half fructose and half glucose. So I think the whole thing's overrated. I don't think it's a good idea long term. And then people will bring up Kempner. Well, Kempner had patients who couldn't maintain their body weight, and he would allow them to have sugar. He gave them sugar, just simple glucose and fructose, because he wanted to avoid the nitrogen, because a lot of these patients were in kidney failure. He wanted to avoid fat because reducing dietary fat kept the patients from becoming hypertensive. So what I'm trying to say here is, I don't think fructose is as bad as Dr. Lustig says it is. He's promoting meat, and he's a big meat promoter, that low carb, paleo, carnivore, keto crowd. Okay. So I think that fructose is unfairly scapegoated as a cover for problems due to meat and whatnot. Okay. That is true. And I'll also tell you, McDougall says, let people put a little bit of sugar and a little bit of salt on the outside of their food. It gets them to eat the plant foods. That's the most important thing. So that's kind of how I see it. I see it as, it's not a great idea. You can also get rebound hypoglycemia from it when you eat big amounts of sugar. But do I think it's that big of a deal? No.
Right. And Eminem is a genius, by the way. Just ask Dr. Dre or 50 Cent or Tupac or all those people who you make music for. Okay, thoughts on OMAD? Of course, you're a fan.
OMAD is just convenient. 1 meal a day diet. I work a long day. I still work full-time in clinical medicine. I'll get home, I'll do a quick video on my YouTube channel, and then I'll eat my food and go to sleep. Okay. And then repeat the next day. And so the OMAD's convenient. I just eat one big meal at night, and that works. And so that's why I do it. I don't do it because it's the healthiest thing in the world. Everybody says eat earlier in the day. But the problem with eating early in the day, number one, on a work day, I don't want to have to wake up earlier in the morning. I want to get my sleep. Number two, you say, well, what about on your day off? Why don't you eat earlier in the day? And I would say, because the smartest a person ever gets is right when they first wake up in the morning. And I always have something I want to do in the morning. I'm either working on a book chapter, or I'm working on making a video, or I'm preparing a lecture or something I'm thinking about. I want to read about some complex topic. That's how it always is with me. And the most important thing to get a lot done academically is, as soon as you wake up, get right in that chair and start reading and thinking and studying. When you eat, your IQ drops, your blood flow shifts to your gut. You often feel sleepy, like you want to take a nap. You got to go to the bathroom, et cetera, et cetera. And so you lose a lot of time. I don't want to lose that time. That time is very valuable to me. I do the most difficult possible thing when I first wake up. And then when I've lost a few steps, by around noon or something, then I'll do something a little easier. And then later in the afternoon, a little something easier. Then I'll work out, and then I'll eat dinner. And at night, I'll sometimes watch educational videos or whatever. Okay, so what I'm trying to say is, that's why I eat OMAD, because it's convenient and it works. I've been able to maintain my health quite well while I'm on it. But in a perfect world, I would probably eat a late lunch and a little bit of a later dinner. But that's why I do OMAD. And other people say, well, there's a great benefit to OMAD, that my gut is only busy digesting food for a short amount of the day. The rest of the time, there's no food stuff floating through my blood, and that makes it easier to control everything metabolically. Other people will say I'm an idiot, because by eating at night, I get more fluid on board at night. Then I got to wake up an extra time to void. So, it is what it is. You got to work with your own context.
Great. Okay. What are your thoughts on creatine supplementation? I've heard it's good for the brain as well as muscles. Concern supplementation cause stop producing its own creatine. Also, Brian Johnson's Blueprint longevity mix. There he is again, similar products. Any evidence certain plants or compounds can extend our lives beyond just eating starch diet?
Okay, well, that's sort of like two questions. Okay, first of all, the creatine. I think creatine is a bad idea. It increases the risk of kidney problems, the possible increased risk of cancer. You go to all the creatine sites and they tell you it's perfect. They tell you no proven problem with the kidneys or cancer or any of this other stuff. I even bought a book reading all the creatine studies all put together into one book. And it would say in the final conclusion, no proven kidney failure or cancer. But then I would read the middle of the text and there would be things that would worry me about increased risk of cancer or kidney failure. And then also I would go to the bodybuilder forums pages, and these young guys would be saying, this stuff put me in kidney failure. I wouldn't take it no more. I don't like any powder food, because tons and tons of powdered foods are contaminated by heavy metal. The makers of it, they throw in a little lead or some other heavy metal. It weighs more. They can sell it for more. So that's another reason why I would avoid it. There's also some stories that they think you'll have increased risk of tendon tears. I got a little bit of a worsening of a rotator cuff tendinopathy that I never had before when I was on the creatine. I was lifting weights, and I wasn't lifting that heavy. So in my opinion, it's too risky. It's not worth the trouble. I wouldn't bother with it.
And then there's a second question about the longevity mix. Or is that the same comment, I guess?
Oh, I don't know what that longevity mix is, but I don't. Oh, Brian Johnson. Brian Johnson's that famous, millionaire, billionaire guy who takes like, I don't know how many supplements, like 50 supplements a day, and he drinks olive oil. That all sounds kind of crazy to me, because if you think about it, taking a pill, a supplement, a drug, it's based on a trust. And you got to study that supplement or drug for a long time, because like I've studied B12 enough to know that I trust taking B12, and I confirm my levels and I know it works and I haven't had any noticeable side effects. Okay. But to be taking 50 approximately supplements, you got to know those manufacturers, the reliability, some proof that it actually helps you and that it's not contaminated and doesn't make you worse. So I would not be eager to jump into that. And olive oil is obviously quite bad for your health. And the fact that he's a big proponent of that makes me think that he really doesn't know very much about what he's talking about. So I don't think that's the path to follow.
Great. Whoops. Let's go back here. Bartholomew, I don't know what that means. How do you...
Bartholomew, I've seen that guy. He's one of the viewers, and he's telling me to look at this statue of Bartholomew. There's a very nice statue of Bartholomew, one of the disciples, okay? And when he died, he was martyred and he was flayed, and they made this big statue of him. Okay, I've seen the statue. It's a magnificent statue. All right.
How do you treat asymptomatic uricemia?
Hyperuricemia. Okay, high uric acid in the blood. You minimize your intake of meat, minimize your intake of alcohol. So don't drink any alcohol. Don't eat any meat. And then don't eat anything with high fructose corn syrup in it. Those are all things that increase uric acid. And that should help. And if you still can't do it with that, then maybe
on the McDougall diet for 8 years. So hopefully the cleanest version, the no cheat version. Okay, my ferritin 151 and hemoglobin are well within normal range. Several of the symptoms of anemia, terrible fatigue, aching heavy limbs, brain fog, shortness of breath, dizzy upon standing, headaches, trembling hands, pale fingernails, and under eyelids. Energy levels improve somewhat when I take iron supplements. Nothing else helps. I follow WFPB diet, no caffeine, good sleep, no booze, no drugs, no smoking. Doctors have no ideas. Blood tests show normal thyroid, good B12, good folate, normal vitamin D, cholesterol and blood sugar, no inflammation issues. Losing weight hasn't helped, but it did reduce blood pressure to 129/84. Exercise regularly, but feel exhausted before I even begin. Terrible afterwards. Felt this way over 2 years, but have been declining for 10. What does iron supplementation help if I'm not immediate? Anemic, what else might help? 49 years, right. Vegan 13.
Yeah, what this guy sounds like his problem is he has chronic severe fatigue of unknown cause. All right, so first of all, too, he said his B12 is normal, but he's giving me a number 120. I like to keep my B12 between 500 to 1,000, okay? Claper says he likes his between 600 and 900, for example, just so you get some perspective on my numbers. Okay, with 120, that sounds low. So B12 could be a big part of his problem. His MCV, did he give me an MCV? I think I remember this guy giving me an MCV, mean cell volume, because I think he mentioned that. He doesn't have like a bad megaloblastic anemic characteristic of a B12 deficiency, but what else could it be? I think this guy might have a B12 deficiency problem. You could double check that with checking a methylmalonic acid, MMA, or homocysteine. Those are typically elevated, and they can cause a functional deficiency of B12. So I think B12, number one, can answer his problem. Number two, he could have chronic fatigue syndrome. Number three, he could have something like myasthenia gravis, a weird autoimmune disease that gives people fatigue. He says his thyroid function is okay. This guy makes additional comments. I've seen his comments before. Let's see, what else? That's pretty much it. I mean, you could look if you're being poisoned in a sense. Are you being exposed to a bunch of mitochondrial inhibitors? A lot of people are exposed to mitochondrial inhibitors and they don't even realize it. Many of the common medications are mitochondrial inhibitors. It's a mitochondrial inhibitor, for example, metformin. Statins are mitochondrial inhibitors. Aspirin, Tylenol, they're all mitochondrial inhibitors. Saturated fat, BPA. So I would go through the whole list of mitochondrial inhibitors and avoid all of them, because your energy, 90% of your ATP energy comes from mitochondria. So you want to be making ATP as well as you can and see if that makes a difference. Check with your doctor. Go to a neurologist and ask him if you need to be checked for any of these other conditions, Maybe you're being EMF'd. You know, you're in some type of EMF environment that's very toxic to your health. Electromotive force, let's say you live right next to a cell phone tower or something.
Interesting. All right. Next, we've got, why does Dr. Rogers think the world wants to hear his misogynistic, racist rants on nutrition? And by the way, I saw one of the replies here was, thank you, I bought his book based on, he convinced me to buy his book. All right, here we go. What's your opinion on rebounding and or vibration plate if you have osteoporosis? Can it help increase bone density? I already resistance trained 5 days a week.
Well, it's good to get exercise. I don't know how much I like the idea of a vibration plate because that sort of like shakes you around without you being able to control it. That doesn't sound appealing to me. I like to be in control of whatever I do. The rebounding, you know, maybe you liked it, all that jumping up and down. A lot of osteoporosis is overrated. Dr. McDougall has good lectures about how they set up the bone density test to make much more women think they're osteoporotic than is the case in reality. And also the funny thing to learn about osteoporosis is read about the Bantu women of South Africa. Okay, they had the average number of babies is 10 babies. That's what women used to have before they had birth control, all right? And they drink hardly any calcium, about the equivalent of 1 small cup of milk. They don't have any problem with osteoporosis. You get your exercise, get your sunshine, you know, you keep moving. That you're probably not going to have a problem with osteoporosis. So what I'm trying to say is this whole osteoporosis thing I think is overrated. Let's see. You know, who gets osteoporosis? Little old ladies who drink milk. So that'd be basically my thought. I like to move my body weight. I don't like the vibration plate. The rebounder, if you like it. I don't really like jumping up and down, but you might like it.
Okay, here we go. Is it safe to eat raw sprouted grains because of OD lectins?
Okay, lectins are like... Yeah, lectins are this protein in a plant food, for example, that binds to carbohydrates. They're usually a pretty much no significance. What I've seen in the last couple of years, last 5 years or so, it's almost like the paleo keto carnivore low carb group had to come up with something to criticize about plant foods. So they've totally exaggerated the problems related to oxalates and to lectins and the carbohydrates in general, like fructose in particular. So I kind of laughing to myself and said, it reminds me of the movie, The Wizard of Oz, when they're going lions and tigers and bears, oh my, you know, it's like lectins and oxalates and carbohydrates, oh my. It's a totally exaggerated out of proportion. There's another, you know, like people are thinking, oh, oxalates are such a big risk of kidney stones. McDougall says they almost never cause kidney stones. That's all exaggerated. And the lectins, you know, what does the lectins mean? Like there's a lot of lectins in beans. You got to soak your beans in water overnight, or I don't even do that. I just boil them. Because the lectins tend to be proteins on the outer surface of the food, and they're water soluble. So if you boil them, they rinse off in the water anyways. So that's good enough. I just boil the beans. I actually don't soak them. I know a lot of people soak them. And that has worked out fine. I've done that for many years. So I think they're pretty much exaggerated. It's very rare that some people are hypersensitive to lectins. And that would be sort of like if you've ruled out everything else and you still have an autoimmune type problem, maybe it's the lectins and you can cut down on foods with lectins like beans, for example. But it's a pretty uncommon problem, and it's totally exaggerated.
Okay, what's your opinion on the best way to get more collagen into a person's diet?
I wouldn't worry about getting collagen into your diet. It's a giant protein. It's a triple helix giant protein. It's like the scaffolding system of our body. That's 1/3 of the protein in our body is collagen. So I would not be worried about getting more collagen in my body. If you want to have better collagen in your body, I would avoid the things that damage collagen, okay? Tissue ischemia, lack of blood flow, can damage collagen, okay? Lack of vitamin C. You need vitamin C to hydroxylate your prolines. Almost every third residue is a hydroxyproline in collagen, okay? I would avoid fluoride, okay? You don't want that in your water or your toothpaste or anything because that can substitute for hydrogens and bind to the collagen and disrupt the triple helix. The other thing that'll do it is glyphosate, glycine phosphate, glyphosate it's usually called. It's that herbicide sprayed on lots of things. And that will substitute, according to Stephanie Senna, she's an MIT PhD researcher. She studied this for a long time. She wrote a good book, Toxic Legacy. It's kind of like this big book, small print, biochemistry with no pictures, okay? But it's still a brilliant book despite that. Anyways, she feels what's happening is the glyphosate is substituting for glycine in your proteins. The reason you got glycine, every third residue in collagen, is because it's very small. It has the smallest side chain of any amino acid. It's just a hydrogen, Okay, just a hydrogen, a small side chain, you can pack that in tight because you got triple helix. That means 3 protein fibrils strung around each other. So how do you get them all tight? You want small side chains in a lot of locations around the tight curves. And what I'm saying here is when you throw a glycine phosphate in there, it's really, think of it as being like a glycine with a phosphate attached on that side chain. There's a tiny bit more to it than that, but that's basically what it is. What that means is now you got a bulky phosphate, you know, it's a phosphorus group with a couple oxygens on there. It's going to distort the shape of your collagen and weaken it. Okay. And so that's not good. Alcohol is also bad for collagen. So what I'm saying is, like, why do I believe this stuff is probably true? Because I look at lots of spines, and I can tell you, since I've been looking at spines since around 1990 to now, I see much more diffuse idiopathic skeletal hyperostosis. That's also known as Forestier's disease. And part of that, of course, is due to ischemic degenerative disc disease. But I also think there's probably these other things contributing to it, because I just see it almost every single patient. I almost like it'd be part of my macro for dictating a case. Diffuse idiopathic skeletal hyperostosis with vertebral body bridging osteophytes. Okay. There's just tons of them. I see it all the time. So it's super common. And give you a little perspective, I used to read articles like, back when I was a resident in the early 1990s, it would say, disc and OPLL, ossification of the posterior longitudinal ligaments, are rare diseases seen more often in Asians. I'm like, yeah, right. BS. I see it all day long, every day. On almost every patient, over 50 years of age.
All right, here's the next one. I'm 52 years old, was vegetarian 20 years. For a couple of years, went back to being an omnivore. For the last 6 months, I've been adopting low-fat vegan. Problem is chronic hearing loss. Before I was 25, I could hear perfectly. I also have food intolerances. For example, when I eat dark chocolate, the next day I can hardly breathe. When I was a child, I had severe asthmatic bronchitis till I was 7. I noticed that when I have food intolerances, when I drink caffeine, when I don't get enough sleep or I'm tired, my hearing loss gets worse. Already have done all the tests, CT scan, audiogram. Appreciate your comments.
Okay, well, a lot of people lose hearing for the same reason they lose everything else. I can tell you this. I actually joke one time, there's 2 categories of diseases. On the internet, everybody's deficient in somebody when you hear all these lectures, because everybody wants to sell something. I think you're deficient in this, you're deficient in that, buy my thing, okay? But in the real world, let me tell you what it's like in a hospital. I don't even look in the chart, because like a resident will call me, can you come in this room, help me do the biopsy, help me do some other procedure? I automatically assume all patients over 50 in the United States, they're all pre-diabetic or diabetic, they're all hypertensive, they all have coronary artery disease, they all have cerebrovascular disease and the related conditions, and they probably have hiatal hernia with gastroesophageal reflux, okay, and abdominal pressure syndrome. I don't need to look in the chart. It is so common. I've looked at many thousands of medical charts and worked with many thousands of patients. I can tell you almost all of them have the same thing. So what I'm saying is all of these are the diseases of the Western diet, a high-fat, high-sodium diet. Okay, so if you don't want to get those diseases, avoid those things, because what happens is the 2, gateway diseases are hypertension and diabetes, and those cause atherosclerosis. Then they plug up the arteries, and as soon as they plug up the artery, you start losing the function of things. People get back pain because the arteries of their spine are plugged up. They get a drop in their vision. All the vision loss things are all vascular related. C-dog is what I call them: cataracts, diabetes, hypertension, age-related macular degeneration, glaucoma. Okay, so they're all diet related. And what I'm saying is you plug up the ears to part of your hearing apparatus, you can lose your hearing like that. Okay. You can lose your hearing from going to a rock and roll concert. So I don't recommend going to a loud music concert. I love music, but not a loud concert like a rock and roll concert or something. What else can do it? The guys who work in putting air into the tires, who work like at a tire replacement place, that sudden sound like zzz, when the air pressure injector goes on, that sudden increase in pitch, that'll destroy a person's ears. Working with that all the time. They should wear ear protectors. Okay, so anyways, you can wear ear protectors whenever around loud noises. There's a lot of noises even in a house that are loud. If you're vacuuming the house, wear ear protectors. If you're making a blend or smoothie, wear ear protectors. If you're running the garbage disposal in the sink, wear ear protectors. Okay, nothing good about being deaf. So that's what I could tell you. Sometimes high dietary sodium worsens the condition of the ear, like Meniere's disease. So it's kind of comes back to the same thing. Make yourself as healthy as possible, and hopefully some of your hearing will come back. Go to an audiologist, get your hearing tested, talk to an ear, nose, and throat doctor, see if they have any helpful suggestions. They'll quite often get an MRI of the brain to rule out acoustic schwannoma, vestibular schwannoma of the internal auditory canal, but we almost never see those. But you can check for it.
All right. It says the doctor, that's you, has come out with a few really big books within a relatively short amount of time. Was AI used? No, this is Peter GPT. He's smarter than any AI. It says, and I saw some reviews complain about Kindle formatting. Is that something he has or could be addressed?
Yeah, I like. What am I supposed to apologize for being smart? And I would never use AI. AI is a joke. AI has no judgment. AI can't tell the difference between corporate funded research versus reality. Please.
Good, good. All right. Next is YouTube has started auto-translate voice, and the voice I picked for Jeff Nelson is awful. Okay, sorry about that. I'm 39-year-old female diagnosed with Crohn's disease 5 months ago, 5-centimeter long stricture, string sign and small bowel follow through in the terminal ileum. I have been following Pam Popper's IBD program, high starch elimination diet since diagnosis, haven't started medication. One, how concerned should I be about radiation exposure from multiple radiological tests like CT scans and small bowel follow throughs? Any suggestions on things to try to look into going forward, lifestyle approaches, medication procedures, given that my abdominal pain, nausea, and early satiety have improved but not entirely resolved after 5 months of dietary approach?
Okay, well, for Crohn's disease, that's a form of autoimmune disease. You know, you're having leaky gut and you're getting some, bacterial toxins and whatnot into the gut wall and you're having a hyperreaction to it. Sometimes it could be due to gluten. I thought there was an interesting paper by that same lady, Stephanie Seneff. What she claims is a lot of the so-called gluten sensitivities are actually due to glyphosate. And the glyphosate could be attached to the gluten on one of the gluten-containing foods, things like wheat, rye, and barley, for example. So that would be a good motivation to only eat organic. And I would avoid all the things that are gluten-containing. That's another thing, because people think of glyphosate as primarily being sprayed on soy, but it's actually sprayed on at least 70 different foods. It'll facilitate the leaves falling off of plant food right before harvest to make it easier to harvest whatever it is you're trying to harvest. So they'll spray it on non-organic oats, on non-organic beans, on a whole bunch of things. There was some website, I think it was called Living and Loving Fruit, something like that. You just type it in your browser, what is glyphosate sprayed on? Okay, and you'll be amazed. It's like at least 70 things. So that's another reason why I only eat organic, for that reason. Other things about Crohn. She asked about, what about all the X-ray exposure? Well, one of the things I would say is you should only get an X-ray, CAT scan, a small bowel follow through, a barium or something, if you're looking for a specific finding that's going to change your management. Because quite often people are always taking pictures of diseases. And you don't cure a disease by taking a picture of it. You cure a disease by changing your diet or your lifestyle, your chemical toxin exposures. That's how you make things better. So if you need to get the imaging, then get it. And the amount of radiation in an individual CAT scan or barium small bowel follow through or something like that is not that much. It can add up over amount of time. But if you're doing it for a good clinical indication, then the benefit outweighs the risk. But if you're just getting it for a routine follow-up or something, then I wouldn't do that. And I'm not a big believer in routine follow-ups. Doctors, always get too much imaging. There's a joke about radiologists. They said, what's the definition of a radiologist? A radiologist is a weasel beneath a hedge eating a waffle, okay? Because they're going to see things where the risk is 1 out of 1,000, and they're going to recommend a follow-up, and the internist who ordered the test is always going to get the follow-up, or whoever the doc is. The reason is they're scared medical legally, because let's say a radiologist looks at a chest CT or a chest CT is at the top of an abdomen CT. There's very often, like in 7 out of 10 patients, a micronodule in the corner of the film, something from when the kid had a cold when they were 10 years old. But nobody knows on the first picture. It's only a snapshot in time. Is that cancer? Okay, so they're going to have to come back in 6 months, then 12 months, and then at least for 2 years follow-up. So that's why I'm a big believer in images seldom as possible, only when you have a very important specific question to answer. And then for the Crohn's disease, how do you get better? We recently had a lecture here on Veg Source, went all through this autoimmune stuff, and basically do the standard stuff to fix leaky gut. Low-fat vegan, eat more fiber, avoid all the stuff that causes leaky gut. If you're still having problems, start looking for other less common causes. Inhalational causes of autoimmune disease. Consider an autoimmune diet. Like I said, some people are sensitive to rare things. So you can go through the whole elimination diet. Dr. McDougall has the whole elimination diet. And that might help you to improve as much as possible.
Great. Does red light therapy benefit mitochondrial function? If so, how?
I've heard some things saying some positive things about red light therapy, but I also read, in several papers, risk of, injury to the eyes. And my attitude is there's nothing red light therapy could do for me that would outweigh the risk of eye damage. So I wouldn't go. I just lost interest in it. I haven't studied it since then.
Okay. All right. Here is second question. Has to do with great guest, Professor David Nutt, UK-based. Listen to, again, on John Campbell's Rumble YouTube channel. Dr. Nutt is a man of many hats, leading expert on brain chemistry, the effects of ETOH, and the GABA system. Has he heard of or read any of his books? He also has a product out, a drink for the non-drinker. There's a market out there, okay? Thoughts on this guy?
I looked this guy up, okay? And he's real fat, and not to be mean, but I'm just saying, I don't know how old he is, but he looked to me like he's at least 60. Okay, I'm 61. I got no medical problems. I don't take any pills. All right, I'm skinny. I weigh the same thing. I weigh less now than I did in college. I weigh about 163 pounds now. In college, I weighed 175. I was a big muscular guy. All right, so what I'm trying to say is, if you haven't figured out how to make yourself healthy by the time you're 60 years of age, you're going to be less able to help other people to be healthy. Okay, and then the second thing is, what is this guy famous for? He's famous for claiming that a lot of mental illness patients could be improved if we gave them psychedelics. Psychedelics are drugs like LSD and stuff. And to me, that sounds like nonsense. The brain is designed to work based on low-fat vegan diet, living like Adam and Eve outdoors, okay? What's the purpose of having a brain? So you can walk down a path in a forest, a jungle, a prairie, and survive, okay, and reproduce, okay? It's not made so it can take LSD. That sounds insane to me, because then you're messing around with your neurotransmitters and your synapses. Anything that messes around with your neurotransmitters and synapses causes brain damage, because the brain, whenever it encounters an unusual change or situation, it tries to compensate for that. And that compensation changes your synapses. There's no proof whatsoever. All that stuff about a single neurotransmitter, single neurologic psychiatric disease was all nonsense, okay? The serotonin deficit with depression, none of that stuff has ever been proven. Probably the best psychiatrist who ever lived was Peter Bregan. And he says all psychiatric drugs, every single one of them, causes a slowly progressive lobotomy. And the antipsychotics in particular, things like Haldol and whatnot, Abilify and whatnot, those can cause a rapid lobotomy, okay? I'm not kidding you. I'll actually give you a video to watch if you're curious about this subject. If you go to Dr. Joseph, it's like Joseph, something like that. He's a psychiatrist who did a lot of research on neuropsychopharmacology, and he has all these patients being interviewed about lobotomy effects from antipsychotics like Abilify. Just go watch. You'll see for yourself, okay, as well as from all these other psychiatric drugs. They all cause brain damage, okay? Robert Whitaker has written great books on the subject. There's been other guys who've written about it, Davies, Yolanta Moncrief or something's written about it. I had an interesting interview here on VegSource. It was something about who's the crazy one or something like that from my Food, Mood, and IQ book. The second chapter it was about a psychiatrist I know who was very close to me. It was my father, okay? What I'm trying to tell you is neuropsychiatric medicines are totally overrated. I'm not aware of any of them that do more benefit than harm. All right. And I say that based on extensive study of the subject.
Beautiful. Would you take a statin drug at age 80? Cholesterol over 205, LDL over 250. I'm not overweight, BMI 26, no diabetes. My doctor prescribed 40 milliliters Crestor. I'm worried about side effects. Wanda.
Yeah, my attitude is that there are some rare people who've got these rare familial hypercholesterolemias, but that's rare. The vast majority of people can fix their problem if they'll just tighten up their diet and pay attention to all these things like I told you about, minimizing dietary fat, increasing your K-factor ratio of potassium to sodium. And the reason I say that is I'm not a fan of statins, and here's why. Number one, it's a mitochondrial inhibitor. The last thing I want in the world is to take a drug and inhibit my mitochondrial energy, my energy production system, okay, fundamental to life on Earth and for each individual, all right? They increase your risk of diabetes a little bit. I don't like the sound of that. The patients who lower their total cholesterol, let's say you get down to 140. If you get your total cholesterol down to 140 by diet and lifestyle, you are protected from coronary artery disease and having a cardiovascular event. On the other hand, if you get your total cholesterol down to 140 just by statins, you're not protected anywhere near as well as you would be if you did it by diet and lifestyle, okay? I think that's a big deal because, I got my internal medicine friends and they tell me, they can get all the numbers right. You call it euboxemia. All the numbers are in the right in the boxes when they write the graphs of the patient's lab results, but they still will have problems. So I would say do everything you possibly could to fix it with diet and lifestyle, including what I mentioned about the K-factor ratio of potassium to sodium, because that also causes insulin resistance. Go through all the things that cause insulin resistance as well. There's a lot of things that cause insulin resistance. We just went through all the hypertensive stuff, but there's weird things that cause insulin resistance. Yes, it's the high-fat diet. Yes, it's the high-sodium diet, but there's all kinds of weird things like PFAS, perfluoroalkyl. Those chemicals, like with nonstick cookware, I wouldn't use those. I wouldn't use that nonstick dental floss. Other things that'll cause that, I would avoid all SERCA inhibitors, anything that smells bad. There's a whole bunch of little things. These are minor causes of insulin resistance, but I would avoid all of them, especially if I was having a high problem, like with a high cholesterol, 205.
Great. Okay. What is the difference between blood lipids and triglyceride? Why are high blood triglycerides bad? Okay,
lipid means fat. So when you say blood lipids, you're saying blood fats. Triglycerides is one type of blood fat, and triglycerides are also a risk factor for coronary artery disease. What types of blood fats will cause blood sludge, sticking together the red blood cells? Sticking together the red blood cells means that you're getting them to aggregate, and when they stick together, they're at increased risk to clot. What is atherosclerosis? Atherosclerosis is a blood clot. Okay, so you're increasing your risk of having a blood clot, heart attack, or stroke. Why do we have a blood pressure? We have a blood pressure to pump blood to the top of our brain, our cerebral cortex. That blood has to be pumped against gravity. Normal blood is thin like water, so it's easy for the heart to pump it to the top of the brain at low pressure. The average Westerner eats a high-fat diet, which sticks the red blood cells together, blood sludge, so now you're pumping thick blood to the top of your brain. You're pumping a milkshake instead of water. Pressure has to go up. They also eat a high-sodium diet, so now the brain arteries and the rest of the arteries, they're vasoconstricted. Okay, when the arteries are vasoconstricted, they're narrowed, you're pumping thick blood through a narrowed system, pressure has to go up. And you start superimposing things on top of that, like caffeine. Caffeine's also a vasoconstrictor, so you get even more narrowing of the arteries on top of what you got from the dietary sodium. Pressure has to go up. Plus, caffeine vasoconstricts, in particular, your frontal lobes. It's part of the stress response. Remember we talked about that, catecholamines and cortisol being moved up. For acute stress, the mnemonic is being chased by a tiger in the dark. You just need to do something physical, run and climb a tree, fight back, dig a tunnel, or whatever the heck you're going to do. Okay, but the point is that's impulsive, immediate response. It shuts down by about 25% the blood flow to your cerebral cortex. So you're superimposing all these problems on your brain. You don't want to do that. That's not good for brain health.
Okay. One, I have problems with rotator cuff, tendonitis, and spine, due to a combination of sport kickboxing and age 65, and 2, ferocious keratosis. I'm not sure, I've never heard of that. Vegan for more than 25 years, tried multiple supplements for joint, skin, etc., but nothing seems to be effective. I understand biology of aging body, practically irreversible, hoping you may provide me and other geriatric vegans with advice.
Yeah, we went through all this. This is basically, what do you do if you have pain, arthritis? And like I talked about, you want to optimize blood flow. You want to avoid the things that cause diabetes and hypertension, because those cause atherosclerosis, blocking up the arteries that feed the organ. Everything works better with good blood flow. You want to keep your arteries open. So we went through all that.
Okay. I'm only going to add dead hangs. Dead hangs. I'm a huge fan. I had a shoulder injury, and for about a year, I was in pain all the time. Nothing I could do to really do it. And I saw some orthopedic surgeons on YouTube talking about dead hangs and just hanging for like 60 seconds. So I got a bar and I put it in my office, and I have one in my bedroom, and I just hang whenever I think of it. I go over and just hang for 40 seconds, 60 seconds. And in about 3 months, my shoulder resolved, and that was probably 2 years ago. Nothing ever came back. So dead hangs, give it a shot for shoulders. Question, you did a video in the past about higher B12 levels might actually be bad. Does Dr. Rogers have an opinion on this and supplementing B12?
Okay, well, I think the best supplement for B12 is methylcobalamin. Get the one with the fewest possible ingredients. A lot of them contain stevia. I wouldn't take stevia. Stevia, I think, is a toxic chemical. The fewer the ingredients, the better. The fewer the ingredients, the less likely there's going to be a problem with any of those additional ingredients. I like keeping mine between about 500 to 1,000, because I think the old ideas of, 150 or 200, I think those are too low. There's a guy by the name of Joseph Chandy wrote a whole book about vitamin B12 and how a lot of these patients in the lower part of the so-called normal range were having symptomatic B12 issues. And then, like I said, too, you could do the other things, check MMA and homocysteine to make sure you don't have a functional B12 deficiency. So that's it. I wouldn't take cyanocobalamin. I think that's a bad idea because it's cyano. Okay, you know what that stands for? You know what? Okay, I don't want any of that. And people tell you, oh, it's such a small amount. It's no big deal. Yeah, right. And there's a little bit of that in flax. Another reason why I won't take flax at all. There's a little bit of that in almonds. Another reason why I would never eat almonds. Let's say you got a person who's eating all three of them, flax, almonds, and cyanocobalamin. I'd be worried about it. I wouldn't do that.
Yeah, in my video about it, I tested mine. I was up at like 1,400. I was going a little too hard. So for me, it was more how much do I need to take? And I was taking more than I needed. Okay, what are the percentages for fat, carbs, protein you recommend to shoot for on a daily basis for long-term health?
I don't really think about it, but if you eat a low-fat, plant-based diet, you're going to probably end up somewhere similar to 80-10-10, or even a little lower in the percentage of calories from dietary fat. Dr. McDougall said the typical average number of percentage of calories from fat with his diet was 7%. And I think mine are in that ballpark, or even a little lower, about 5%, because I ate a lot of white rice, and I ate a lot of really low-fat stuff, and I ate a lot of fruits. Fruits are often very low in fat. But I think a reasonable number would be 80-10-10. That's where most people pretty much end up. Most plant foods are pretty low in protein other than beans. Oatmeal is a little high in protein too, in the ballpark around 15% or so. Not too bad. I think that's a good place to be. If you look at the Mastering Diabetes, that guy's pretty smart. His name is like Robbie Barbero. I think he's pretty good.
Robbie Barbero.
Robbie Barbero. He's a pretty smart guy. He did a good lecture on literature review of the papers on diabetes, for example. And he recommends try to keep your fat below 15%. And he knows a lot about insulin resistance. I think it's a good idea to try to keep it below 10%. Also protect yourself from high blood pressure and obesity and all these other problems that I see. But that's what I'm saying. About 80-10-10 is usually pretty good. Maybe 15% for some young, healthy, active person with the fat. But I think in general, 80-10-10 is pretty good. And I like to keep my fat even lower. And also, I don't seek out protein. I'm perfectly happy to have my protein a little lower because beans are convenient for me. And there's always a question like, who's going to cook for me? Okay. I used to be married and have a couple different people cooking for me, and they'd make a lot of beans. So I was probably eating a little more beans than I needed to. But now I've got a little more control over who cooks for me, and she makes less beans. And that's fine with me too. I don't need all those beans. A little bit's okay though.
Okay. Here's one. Whoops. I keep pushing I'm on my laptop, so it's weird. Hi, Dr. Rogers, huge fan to find their basic nitty-gritty as well as cash-fueled misinformation about chicken, beef, eggs, and dairy, especially milk, that needs to be taken on in the most effective way. Knowing that, can you focus some talks and talking points about those specifically, because I need to get through to my family. Okay, so this one is about dealing with your family, I guess raising kids on a healthy diet, and how do you deal with people who are brainwashed and think you're doing harm to them?
Okay, yeah, like one of the big things is everybody thinks you have to eat milk, that milk is such a healthy food. Number one, milk is like the strongest food associated with autoimmune disease, okay? It's the number one association with type 1 diabetes, which is a really severe disease, okay? It's also the number one thing associated with multiple sclerosis, another severe autoimmune disease. And a lot of people also with rheumatoid arthritis have told me getting rid of dairy was the most helpful thing they did. There's no animal in the wild that drinks milk after it's been weaned. There's no animal in the wild that drinks the milk of another species. So those are all reasons why it's an unnatural thing to be drinking cow's milk. Dr. McDougall would emphasize it could contain viruses like bovine leukemia virus. I lost interest in milk because it increases the risk of prostate cancer, even if you use the skim milk. Okay, so even the low-fat version is still a problem. You think about milk, what's the purpose of cow's milk? It's to make a cow gain about 600 pounds in 1 year. Okay, so it has a big time activation of like mTOR, mammalian targeted rapamycin. That's a growth replication pathway. Your body has a seesaw between mTOR and AMPK pathway. And the point is mTOR is like a contractor getting ready to build a building, and it won't build until it has all the building materials. And milk sort of provides just the right amount of, let's say, amino acids to get you to, like a lot of leucine, for example, to get you to want to build. So T. Colin Campbell, China Study book, he said the number one most common cause of cancer, in his opinion, was animal protein, especially casein, the milk protein. Okay, so those are reasons to avoid milk. I don't like soy milk. I know a lot of people in the plant-based community think soy is great. I think soy is a lousy food. I think it is totally exaggerated. I've gone back and read all the old papers on it. It's estrogenic. It causes premature puberty. It causes decreased sperm in men. It can cause problems with the female reproductive tract. A lot of the papers say that it's so wonderful, our corporate funded. So I don't think soy is a good food to be feeding people. I think nuts aren't such a bad thing in kids because some kids, they're really growing rapid. They can handle the extra calories. I don't like nuts for older people, though, because they're super high in fat, 70 to 90% fat. They also are relatively high in advanced glycation end products. They're a little bit acidic. So those are all reasons why I'm not a fan of nuts for adults, but I think for kids, they're okay. You could feed kids a little bit higher on the fat side of plant foods if they're burning a lot of calories and they're super skinny and all that stuff. The oatmeals, the quinoas, the garbanzo beans. Garbanzo beans taste good, too. All the processed food is full of toxic chemicals, so you don't want to eat it. Animal foods, typical animal, they're giving them estrogenic hormones to make them gain weight faster. That's bad. The non-organic stuff, they're feeding them in a CAFO, concentrated animal feeding organization. They're feeding them GMO corn, GMO soy that bioaccumulates, and then you eat that stuff and you get really high levels of these herbicides that are highly toxic to the human body. So, McDougall had said it before, if you eat a low-fat vegan diet, you'll get all the nutrition you need through all phases of your life, including pregnancy. So I think that's the healthiest way to go. Starch-based, plant-based diet.
Yeah, I think of soy milk as like a condiment some of you use occasionally, but I certainly wouldn't use it regularly. Okay, my husband taking a cancer medication called Itovebi for cancer. The medication causes hyperglycemia and his glucose levels are in the 200s with metformin and insulin. We eat whole food, plant-based. He's 68. Any recommendations for how he can keep his glucose levels in control? He had normal glucose before he started this medication.
Yeah, you can see if you could substitute a different medication for it. We talk about metformin being another inhibitor of intermitochondrial membrane electron transport. So what's the mechanism of fat causing insulin resistance? Because it's an inhibitor of the intermitochondrial membrane. Okay, so could you take a different medicine? Maybe that would help. You could avoid all the other things that increase insulin resistance. I went through a bunch of them just a moment ago. See if that makes a difference. Do you have to take that medicine for the chemo? Because then you're kind of got yourself into that context. So I would go by that.
Great. Why don't you guys take the age tests out there, maybe put them in the Rejuvenation Olympics. Brian Johnson, I think it'd be great. Brian Johnson, the guy with all the supplements. What are the age tests? I don't even know what those are. Yeah,
I don't specifically know the age test, but I can also tell you, I'm not that big a fan of just getting all these random tests and do I trust the results? You have to ask yourself, though, how do you know that you're doing well? I do check my total cholesterol once in a while. It bounces between 90 to 140. I'm working to get my serum ferritin down. I'd like it to between 30 to 80. It's currently about 110. Because when I was a kid, I used to think Raisin Bran, not when I was a young man. I thought Raisin Bran was good for me when I was like an athlete in college and stuff. I didn't know all that extra iron that was added to it was a bad thing, but I was always in the normal range. But ideally, serum ferritin, you'd like it about 30 to 80. So I work at getting that down. I checked some of my other labs just to make sure they were good. They were all good. But what I'm trying to say is I don't check stuff unless I have a good reason. I check my vitamin B12 periodically because I want to keep that between 500 to 1,000. So those are sort of the main things I worry about. But I'm not a big fan of checking. Like, for example, a lot of patients ask me, should I get a cardiac calcium CAT scan on my heart? And I think that's stupid. You already know you have coronary artery disease if you used to eat a Western diet. So what you should do is treat it. What I'm getting at is everybody wants to take a picture of your disease. In any hospital in the Western world, you're going to see lines for blocks long in the morning. All these people waiting to get a CAT scan, an MRI, an ultrasound, an X-ray, a blood test, or a tube up their butt, for colonoscopy, for example. And what I'm saying is almost nobody, 1 out of 10,000, is saying to themselves, how can I lower my risk of these diseases? Become a low-fat, low-sodium vegan with no oil, no alcohol, no caffeine, okay? There should be more focus on what can I do to improve my health rather than all this tests and stuff. If you ate a Western diet, like William C. Roberts, the famous cardiac pathologist who did thousands of autopsy studies on coronary artery disease, he said if you ate a high-fat diet any herbivore, plant-based animal that's fed a high-fat diet, they always get atherosclerosis, 100% of them. You know you have these diseases. So start optimizing your health instead of worrying so much about tests and all this stuff and spending all your money on that.
Yeah, I get a blood test once a year. That's about it. I don't go in for a physical. I haven't had one in 15 or 20 years. And don't go looking for trouble is kind of my strategy too, in terms of doing lots of tests. And I agree, just assume you got heart disease. Assume I know that I've got a high LP little a, which I brought down through fasting, but I don't know that that puts me off the hook. I better be very careful that if you live that way, maybe you'll live longer. Okay, Dr. Rogers, I had my gallbladder removed several years ago. Since that time, adopted a starch-based diet. Are there other things I should be doing? Do I need to take digestive enzymes?
No, I would just stay on this low-fat, starch-based diet, and I would avoid the high-fat foods, and I would eat plenty of fiber to keep your stool moving along, so to speak. Fiber adds bulk to the stool. It attracts water to the stool, and that increases the transit time a little bit. And it helps, I think, protect you. You don't want a slow transit time because you can form secondary bile salts. When you have a gallbladder, it stores up the bile, so it's released when you have a meal. When you have a cholecystectomy, gallbladder removal, you leak a little bit of bile through the day in there. And so it's good to have a good transit time by eating plenty of fiber to help, I think, lower your risk of colon cancer. You don't need enzymes. The pancreas makes your enzyme, a little bit made in the stomach too for digestion. You don't need to be taking enzymes. So they'll talk you into all kinds of things. I'm not aware of a benefit to taking enzymes.
Great. Greetings, 100% WFPB since breast cancer, 2013, 67-year-old woman. How do I add muscle mass to my sarcopenic legs and arms? Workout in senior geared stretch, weight balance, and stretch classes for the past 6 months, 4 days a week at least. Electronic impedance health scale shows skeletal muscle at still 44%, no gain in muscle, but I feel way stronger. What to do? My bone doctor says no weight over 10 pounds due to osteopenia. Get 65 grams. I guess that's protein a day from tofu, tempeh beans, lentil seeds, a few nuts, 5,317 pounds.
Yeah, I mean, the main spot you're going to maintain your muscle strength is by exercising. Get your sunshine, get your sleeps. I would not focus on the worrying about the protein too much. I think that's totally exaggerated. These people in all these, epidemiology study communities, they're not seeking out protein supplements or anything. I think that gets exaggerated because it helps a lot of corporations to sell stuff if people want protein. And I would never take a protein powder. Those are pretty routinely contaminated with heavy metals, like what you see if you read the Consumer Reports articles about them.
Great. Okay. Next question is for me. Hi, Jeff. How's your wife after red tea? Liver failure. Dr. Greger recently did a rooibos tea video. In my opinion, sort of minimized liver concerns, although he did mention the studies. What do you think? Well, I mean, Sabrina was scared straight. She's not taking any herbal teas ever again like that. And it was a scary thing. The fact that it resolved itself completely after she stopped drinking the tea pretty much identifies, she got a bad batch. Is all rooibos tea like that? Probably not. Was she particularly susceptible for some reason, or maybe drinking, too much based on how much other people drink? I think you got to be careful with these things. And the story. Peter is the guy. We just sort of starting doing videos together, and he's the one that suggested the tea, which led us. The liver doctors, they didn't think about that. They asked her if she was taking supplements. They didn't ask her if she was drinking herbal teas. But it's a serious thing, and I wouldn't mess around with it. Whatever the benefits that the rooibos company, scientists have come up with, you're going to be fine without it. So I don't think it's doing anything great for anybody, to be honest. Okay, Peter, any comment on rooibos?
You got it. Yeah, I wouldn't drink that stuff.
Here is a 74-year-old woman, vegetarian since 76, vegan a few years later with no health problems so far. A few years ago, discovered I have 2 copies of the APOE4 gene. I did a 23andMe test. My mother had Alzheimer's. My sister now has it. Both were diagnosed in their 60s. I've read that I should take around 1,000 milligrams omega-3s per day since the essential components of brain cell membranes play a role in maintaining their structure and fluidity. Thoughts?
I think that omega-3 stuff for prevention of dementia is totally exaggerated. You gave a very nice lecture about that. I recommend everybody watch the Jeff Nelson lecture about omega-3 supplementation for cognitive function. And I can also tell you, I look at tons of brains, okay, many thousands of them. I'm a neuroradiologist. This is one of the main things I do. And I also think that there is such a thing as familial Alzheimer's, but I think a lot of the so-called sporadic Alzheimer's is not even a real disease, not even a real thing. The numbers of Alzheimer's due to sporadic form were totally exaggerated because it was a way to generate a lot more research funding. There's a whole bunch of books written on, not a whole bunch, there's several books written on, and one of them is How Not to Research a Disease. Okay, but what am I getting at? Somebody is so-called Alzheimer's, they come into your office. What question can you ask them? There is no question to diagnose a disease. Can you put a stethoscope on them? No, there is no physical finding to diagnose a disease. And you say, what about the imaging, the so-called focal atrophy of the parietal lobe and the medial temporal lobe? I almost never see that, okay? You say, well, what about the nuclear medicine test with the beta amyloid protein? It's not that reliable. What about autopsy? Certainly senile plaques, extracellular, neurofibrillary tangles, intracellular. Isn't that pathognomonic? No, it's not. Look at the cognitive reserve theory coming out of Mankato, Minnesota with the Notre Dame nun study where these nuns donated their brains to science. And what they found was that the nuns that had been more academic, who enjoyed teaching and writing letters and reading a lot, despite having extensive so-called senile plaques, they had intact cognitive function. And then the ones that hadn't been too interested in reading or thinking or writing or any of these sorts of things, they could be demented despite not having much of that at all. So they can't even confidently diagnose it at autopsy. Give me a break. And then they have no treatment for it, Aricept or some other drug that doesn't work. So what am I trying to say? What causes people to be demented? And I think the most common cause is a combination of a couple theories here. I'll go through them real fast. I know we don't have a lot of time, but the Jack Delatorre theory is fantastic and useful about mouses. Okay, he tied off the artery of a mouse, and 2 months later, middle-aged and older mice are demented. He does an autopsy. There's no stroke. He just sees a shrunken brain on the side where he tied off the carotid artery supplying the brain with blood. Okay, that's called a vascular hypothesis of dementia because a lack of blood flow led to those brain cells not getting enough oxygen and glucose to maintain themselves, so they go into apoptosis, programmed cell death, and they die. Okay, then the brain shrinks. That's what I see almost always, a shrunken brain when I have to look at a demented brain on brain MRI, for example. Okay. Then there was a problem of more and more Japanese becoming demented. They asked their best neuroscientist named Tetsumori Yamashima, MD, PhD, why are all these people becoming demented? After extensive study, he came to the conclusion it's because they westernized their diet, and especially they're eating lots of fried food. And those were the ones that tended to get it the worst. And especially if they were sensitive, like the ones who couldn't tolerate alcohol, because part of the metabolism of the toxic aldehydes produced from omega-6 cooking oils, like hydroxynonenal and whatnot, leading to lipid peroxidation, and something he called the calpain-cathepsin theory, whereby heat shock protein, like number 70, was being changed by binding with H&E, hydroxynonenal, and then calpain, the protease in the cytoplasm, would digest the heat shock protein. Then the heat shock protein couldn't maintain the lysosomes, and then the cathepsin would get out of the lysosomes, the recycling plant of a cell, and digest the cell. Okay, so that's the Yamashima theory, all right? I think that contributes to it. People should not ever eat omega-6 cooking oils, all right? But then the other theory was my theory, supply and demand theory, which basically means a neuron has a metabolic rate and it has a oxygen and glucose delivery supply. It also has a mitochondria as the extra variable. You make this on a triple axis, okay? So what am I trying to say? He's right, Delatorre. You drop the oxygen and glucose delivery, life becomes tough for that neuron, but it's even tougher if you stimulate that neuron so its metabolic demand is higher. Because normally you have neurovascular coupling, they're matched, but if you elevate the activation of that neuron by more glutamate being sent across by psychological stress, sleep deprivation, and caffeine raise the same hormones. Aspartame is also an excitotoxin. I mentioned sulfites as an excitotoxin. Amphetamines, attention deficit meds, all those things are ramping up the metabolic rate in this neuron. And then you did all these things to lower your oxygen and glucose delivery, like salt and high-fat diets. Those cells are more at risk to go into apoptosis. And now here's the last coffin, nail in the coffin. Most processed foods, they're full of mitochondrial inhibitors, okay, especially, let's say, mold inhibitors, so it doesn't spoil on the shelf, get sent back to the company. Those are typically mitochondrial inhibitors, as is excessive fat, especially saturated fat. And then we just talked about tons of medicines. There were like none of them in all my biochemistry books. I own a bunch of biochemistry books, but then I started looking up in the literature. Metformin, selective serotonin reuptake inhibitors, antidepressant medicines, some of the antipsychotics like Haldol, Tylenol. These are all mitochondrial inhibitors. So the poor neuron, it's trying to survive and make some ATP to pump the calcium out of its cytoplasm. It's always pumping against a gradient. And on top of dropping their oxygen and glucose delivery, the person is also inhibiting the mitochondria with 5 or 10 different chemicals. You know, it's like if you owned a slave and you told the slave, run, 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 and work, and then you whip the slave's legs and said, run faster while you're whipping his legs. It's like, what is he going to do? It's insane. You treat your brain cells, you brutalize your brain cells, you starve them, and you overwork them, and you give them stimulants, and then you tell them to survive on that. It's crazy. People are destroying their brains because they don't know what they're doing, and none of this is in the neurology textbooks. You have to go through the literature extensively, which I've done, okay? And basically, because nobody knows how to make money off it, no one cares. That's what's going on with brains.
Yeah, yes, and I'll only add that after reading a lot of studies and looking deeply into this or trying to, there's no good research that shows that taking a omega-3 supplement is going to improve your brain, prevent dementia, Alzheimer's, or any of that. There's no good research. And companies that try to market their products with that, like Rite Aid did, get shut down. They get sued by the Center for Science and the Public Interest. The FDA comes in and orders them not to use those claims to sell omega-3. You know, they're prevented. They're barred from doing that because there's just no good evidence. People are still doing it. People on the internet, people, smaller companies that sell the stuff. That's where, you know, people, but it's just not there. Okay.
Actually, I want to add one more thing to it because I think that there's a widespread, like almost an assault on the brain. If you look at water, what's in tap water? Typically fluoride. That's a major neurotoxin inhibitor of intermitochondrial membrane electron transport. What else is in tap water? Aluminum. That's also an inhibitor of mitochondrial function, and they bind together. Fluoride binds tightly to things, and it facilitates increased traversal across the blood-brain barrier to get into the brain and cause damage. Okay, aluminum is also very pro-oxidative, increasing oxidative stress in the brain. Okay, that's in your tap water. What is the subsidized food? Typically subsidized soy. What is the soy sprayed with? Glyphosate. Glyphosate's an excitotoxin, increases the activity of the NMDA receptor. Okay, so you get more calcium going through there, overactivating the cell. What else? Atrazine. Atrazine is a mitochondrial inhibitor. That's what's sprayed on your non-organic corn. Okay, so these are major common things that are subsidized, increase in brain toxicity. So people are exposed to lots of these things, and that's why it's worth knowing about all these things. You know, you're walking down the street and there's a car coming towards you, you go, uh-oh, you jump out of the way. But if the car's invisible, how do you jump out of the way? And I'm telling you, this is how you make the car visible so you can avoid these things.
Yes, taking omega-3 is not going to save your brain, but listening to Dr. Rogers can, absolutely. So here it is, Dr. Rogers, whoops. If you were 75 years old with a thoracic aneurysm of 4.6 centimeters, that CT scan showed to be stable for the last 6 years. 2, you had also experienced AFib 3 times in the past that cleared up without medical intervention. 3, your total cholesterol was 120, LDL 53 with statins. Would you feel safe in discontinuing statins if you were strictly following your Spartan diet? Okay, so he's got an aneurysm of his thoracic aorta about 4.5 centimeters. Usually the cutoff for doing surgery is about 5.5 centimeters. If the patient has some type of increased risk context, the aneurysm is rapidly growing, a strong family history of thoracic aortic aneurysm rupture, they got Marfan syndrome or something, maybe you'll operate at 5 centimeters and you go to some specialty center where they've done a lot of them, okay? It's a little more of a difficult procedure. What I would do is I would avoid things that cause aneurysm as best you can. So you want to avoid everything that causes high blood pressure that increases the risk of aneurysmal enlargement, all right? You want to avoid anything that causes the risk of thrombosis, because one of the things you've got is you've got a vasovassorum. That is the small arteries around the outer surface of the vessel. Vasovassorum, like in Latin, means the vessel of the vessels. Okay, and that provides blood supply to the outer part of the aorta wall. Well, guess what? If you clot off part of your vasovassorum, you can infarct the outer wall, the outer part of the wall of your aorta, and now it's weaker and it's more vulnerable to expansion. So by avoiding all the things that cause hypertension, you lower your pressure, that puts less pressure on your aortic aneurysm. You also avoid all the things that are prothrombotic, and you decrease the likelihood of occluding one of the vessels of your vasovassorum. And I think that this patient mentioned AFib. Yeah, AFib is it's already been common. It's becoming even more common. I would avoid everything that causes AFib. That's all bad for your blood vessels. Avoid caffeine. Avoid alcohol, okay? And I think leaky gut's a major secret contributor to AFib and cognitive decline that people are not aware of. I talked about it earlier today in this session about, and the guy, if you want to watch a good video on the internet, take a look at Douglas Kell.
Douglas Kelly's a PhD guy from England, and he made a system biology approach, I think it was, to iron metabolism. And he talks a lot about iron metabolism in the context that iron, free iron, can do the same thing as the bacterial endotoxins, LPS and LTA. The idea with iron is that we do store a lot of iron in our body so that if we're being chased by a tiger in the dark and when he scratches us or bites us and we bleed, we can replace our blood hemoglobin, okay? But we become overloaded in iron and we start having iron leak out and become free in our blood, and that's very bad. It's quite prothrombotic. Iron is like a fire. Eugene Weinberger had said this. Iron is like a fire. You want it in your stove to cook your food. You want it in your furnace to heat your house, but you don't want it anywhere else or it causes damage. And the point I'm making is that predisposes to amyloid clotting, excessive iron. So you want to do all these things. Like, for example, if I had that, I would maybe do therapeutic phlebotomy, get my ferritin down to 30 to 80. What I'm saying is, well, if I was this guy, I would try to do everything to prevent that aorta aneurysm from enlarging. If it does enlarge, maybe he needs to go to surgery. If it's the ascending thoracic aorta, they're going to do an open surgical graft. If it's a descending thoracic aorta, they might do a graft. They might just, put a endovascular stent. But those are basically his options. And doing those things are the same things that will protect them from, make them less likely to have AFib.
Sorry, trying to get in here. I'm on my, there we go. Oh, look at that, circles. What's the cause of notalgia parenthetical? And can it go away, or is there treatment for it? I have pigmentation, comes from scratching. Everything else is great. I just can't get this skin condition to clear up and stop itching. Any suggestions? Doctors are no help.
Yeah, that's kind of a tough one. That's like pain in the upper back between the shoulder blade and the spine, and it can itch a lot. It's not exactly clear what causes it. It's thought it might be compression of the nerve. You got these diagonal muscles called rhomboids, and that the nerve might be getting pinched in the muscles. And, what can you do for that? You can put a lidocaine patch on it. You could put capsaicin cream on it. You could just do nothing except it and try not to itch it. It's not that easy of a spot to get to. You can scratch it with a back scratcher. Again, it's not that easy to touch that far in your back. Again, same old stuff. Optimizing blood flow sometimes takes the edge off discomfort with any type of neuropathy. So that's basically it.
Okay. What are your thoughts on DMSO? Said to improve circulatory system health, treating, for example, neuropathy and hair loss.
Well, DMSO, dimethyl sulfoxide, is like a solvent, and you put it on the skin and it's transdermally absorbed. When I was a junior in high school, I fractured the growth plate on my clavicle. I had caught a guy in a throw and I hit my arm funny. And anyways, my wrestling coach, he's a nice guy. He meant well. He put some of that DMSO on my shoulder to see if it helped me. It didn't help me. It didn't hurt me. But that's how I first learned about it. I'm not so sure how useful it is. You would want to do that under medical supervision. You're going to be pulling something into your body transdermally. I don't know if it really does much good. I haven't heard much about it. I haven't heard much about it either way, being really helpful or being really bad. But I don't usually mess around with stuff if I don't have to. Something transdermally going into you, what is it going to pull with it? I'd make sure it's not combined with anything you don't want.
Okay, male diagnosed with MS 5 years ago, age 41, contracted it because of poor diet. What's your view of swank diet versus Wall's diet? Any tips on ED?
I think Swank is legit. Swank's an MD PhD from Harvard who did research on MS for many, many years. He followed his patients for, up to 50 years. He published studies of them for over 34 years with fantastic results. And Swank became good friends with Dr. McDougall, and Dr. McDougall worked in his program. Dr. McDougall said he's 100% legit. I saw Swank's lectures. I read his book. They were very good. He figured out a lot of stuff about blood sludge. So I think Swank was totally on the right track. He especially emphasized reducing saturated fat. I think it's also wise to reduce unsaturated fat, PUFAs, polyunsaturated fats, because they're quite atherogenic, and you also get in all that omega-6 toxicity issues, like I was just talking a moment ago with the Yamashima theory of lipid peroxidation, calpain-cathepsin, all that stuff. There's no reason to eat omega-6 oils. So I would think that's a way to go. Plus, when you eat a plant-based diet, you protect your gut from leaky gut. There's a lot of leaky gut things that are associated with neuroinflammation and cognitive decline. So you protect yourself from all that. So I would recommend the the Swank-McDougall path. Dr. McDougall has several lectures on multiple sclerosis that you could watch.
Okay. Excuse me. Mick the vegan just posted a video called "Are Low-Fat Vegans Wrong?" and basically said you're wrong. Do you have a response? I think you made a response, didn't you, on your channel?
Yeah.
I saw the other.
Yeah, I'm kind of smiling because Mike the vegan, I think he's a nice guy, but I think he's headed down the wrong path, and he's kind of going down the same path a lot of these guys go down. I think Gil Carvalho's a little farther down this path. Another smart guy who reads a lot and knows a lot, but I don't think you're going to win with this high-fat stuff, guys. I think you should go back to the basics. Read about Kempner. Read about Burkitt. Read about Pritikin, McDougall, Esselstyn. Once you've read all that stuff, if you really understand it, you'll never want to turn away from low fat. There's too much data to support it.
In the clinical world, the guys who actually published research and cured people and turned around a lot of disease are all the low-fat guys. There's no guy that's using fat that's reversing disease. It's more these recent guys that have become in the Garth Davis, now Mick the vegan, the people that are drinking the high-fat Kool-Aid. And they're quoting salad dressing science. They're giving those, oh, you needed to absorb, all these studies that were paid for by Procter & Gamble and places like that. And the vegan community is like on this commercial research binge. It's kind of sad, but without McDougall here to fight it, you're doing a good job, Peter.
Yeah, I think all this high-fat stuff, moderate fat, I think it's all for chumps. I jokingly call this moderate fat stuff the high-fat phonies. It's sort of trying to replace the Dr. McDougall legacy that goes into Dr. Kempner, Nathan Pritikin, and Jeff Nelson's work as well, and Dr. Esselstyn's work. You're not going to win with fat. There's so many problems with fat. It's not even funny. Nathan Pritikin reviewed all the literature on fat. And he said all fat is bad. They're all bad. The MUFAs are atherogenic. They're equally atherogenic with the PUFAs, polyunsaturated fats, monounsaturated fats, the saturated fat. They're all highly atherogenic. You're not going to win. And there's no such thing as a dietary fat deficiency. It's impossible to be too low in fat. That's my conclusion from reading the literature. Nathan Pritikin's, Dr. McDougall's. Pritikin was showing studies where they fed people less than 1% of calories from fat, 0.7%. Okay, there's only two essential fats. There's an omega-3 and omega-6 that we only need in the most minimal quantities, and we get plenty of that from low-fat plant foods. So I'd forget about it. The body can make its own fat for everything else but those, and we need those in very minimal quantities.
So I don't know who this is. What is Peter's thoughts on Nobel Prize nominee Paul Kokachev's research?
Yeah, I know what that's about, digestive leukocytosis. This is a guy who claimed on some one limited study from the 1920s that he thought white blood cell counts were higher after eating cooked food than after eating raw food. And that was used as an argument for raw food being better than cooked food. So, it'd be nice if more people had studied it. I'm not aware of other people studying that in more detail, if there's anything real to it. I don't know if those numbers are even legitimate. The guy later on would write other papers, and he wasn't recommending a raw food diet himself. As far as raw food diet, I do like eating fruits. I think fruits are healthy foods. As you get older, people maybe don't handle them as well. They overeat them. McDougall recommended 90% of your calories from starch, 5% from fruits, 5% from vegetables. And McDougall, he made a video about it. He said that's what all the healthy populations around the world eat. That's about the percentage of starch, fruits, and veggies they eat. And we should imitate them because those are all the healthiest people in the world. That was his conclusion. He said there's no fruitarian populations. Okay, so, there are some conveniences to raw foods. The fruits, in particular, they're very alkaline. They're low in fat. They taste good, but they don't store well. They got seasonal availability issues. They spoil. They often spray stuff on them nowadays. So that's about where I'm at on that.
Okay, here's two questions. What's your opinion on flax seeds in green smoothies, and what should a male drink 1 gallon of water a day?
Okay, I think flax is totally overrated. It's like 60% of calories from fat. It's sort of like Tweedledee and Tweedledum with soy. If you go back to the old papers, you see it's estrogenic, will cause premature puberty, it's goitrogenic, almost all the same problems. That's very common with estrogenic chemicals, that they're also anti-thyroid, goitrogenic, and many of them are also increased risk of cognitive problems and are also mitochondrial inhibitors, okay? Flax has some cyanogenic glycosides in there, means cyanide-like compounds. I don't want that. I don't want anything to do with that. I don't want anything that's 60% fat. Give me a break. It's almost like there's a pattern of anything that sterilizes people and reduces their fertility gets promoted off the charts. Fluoride, aluminum, flax, soy. Give me a break, okay?
And what about 1 gallon of water a day?
Oh, a gallon of water a day. Well, I'm also always skeptical whenever somebody tells me everybody needs to do this. Should a 350-pound NFL lineman drink the same amount of water as an 80-pound lady? You can, McDougall recommended to go by thirst. I would agree with that. You can look at your urine in the toilet bowl and you can see, how concentrated it is. Maybe you're a little dried out, drink some more. You get lots of fluid from eating plant foods, so that's pretty good. It's reasonable to drink some water if you want. I'd recommend you put it in a glass bottle. I think a lot of people are drinking too much bottled water in plastic, and they're ingesting plastics like the phthalates, which are estrogenic in plastic, maybe microplastics. I'd be worried about that. Also, a lot of people drink tap water, and I think that's a stupid thing to do because most tap water has got fluoride in it. It's got all these estrogenic chemicals in it, and that's what I think is a little bit of a joke. They're drinking water. It's a pretty common stereotype, a fat lady walking around drinking water, and she's drinking tap water, and it's got all these estrogenic chemicals in there that might make her gain weight. Estrogen is a fat storage hormone. It tells the woman's body to gain weight because the baby might need that for energy. So make sure the water you're drinking is good. But then you run into a little bit of a problem too. If you're drinking large amounts of heavily filtered water, let's say from reverse osmosis, then it's going to be hypoosmolar, and you could give yourself water intoxication syndrome from the hypoosmolality of it. That could give you headaches, because you can get cellular swelling from that if you drink too hypoosmolar fluid. You've seen that like in runners, marathon runners that keep drinking water every 500 yards. So you could squeeze a lemon or a lime into the water to put some particles into it, so to speak, increase its TDS, total dissolved solids. The little pitfall there is make sure it's a good lemon or a lime and not something sprayed with apeel. Apeel is that common preservative sprayed, especially on avocados, but on other fruits as well sometimes. That contains all kinds of toxic chemicals. You'd be amazed if you read the chem data sheet how bad they are, including acetonitrile, which is a type of methyl cyanide. It's kind of scary, all this stuff that's in a lot of things these days.
All right, here is another. I am oil and salt free. I'm distance runner, trained for ultra marathons. On most days, my sodium intake less than 150 milligrams once a week. Once every couple of weeks, when dining out socially, I might have 1,000, 1,500 milligram on those days in Thai curry, veggie burger, and bread. Do I need to have any concerns about my sodium intake?
Yeah, this kind of sounds like a troll because, if the guy's training for an ultra marathon and he's got a total sodium intake of 150, yeah, right. You're going to sweat out a ton of sodium if you're training for the ultra marathons, and that's as low as it gets, like in the Tarahumara center of the jungle. So it sounds like a little bit of nonsense here. And you're gonna have a higher salt intake. You're gonna have a bigger appetite if you're exercising that much, and you're gonna have a higher dietary sodium than that. So the only point I would make is if you're taking a runner supplement or something, you'd like a little bit of sodium in there because you're gonna sweat out a lot of it, so you need some. Normally, I want to minimize my sodium, but if you're sweating a lot, then you could need a little sodium replacement in that context.
Okay, next question. What is cervical spondylosis? Is that how you say that?
Fancy way. Yeah, it's just a fancy way to say DJD of the spine, degenerative joint disease, osteoarthritis of the spine, arthritis of aging. But, that's all you would want to get out of that. And it's a very nonspecific term because typically, and by the way, I'm the person who figured out the whole theory of the spine. There were earlier papers suggesting that aortic aneurysm and spinal ischemia could be related to degenerative disc disease. But I figured out they're all the same thing. Degenerative disc disease is really a part of the same thing with disc, diffuse idiopathic skeletal hyperostosis, interbody fusion, ossification of the posterior longitudinal ligament, moving more posterior, ossification of ligamentum flavum, OLF, and Bostrop's disease, fusion across the spinous processes. They're all ways to compensate for segmental instability where a disc fails. The individual disc fails, spinous proprioceptors recognizes the instability, and then it has only one thing it can do. It can lay down bone to fuse those segments. When that one is fused, you got increased strain on the adjacent disc, so you got accelerated adjacent segment degeneration, and it just marches its way all the way up to the skull. So from your pelvis, your sacrum to your skull, you're going to have all these bridging osteophytes. So anyways, that's cervical spondylosis.
Great. Here is, I vomited 4 times one day months ago. Food poisoning is a possibility. Helicobacter pylori was not detected. I have been a Spartan vegan for 6 years. After meals, I experience a burning sensation like acid reflux in my stomach and esophagus. What can I do to diagnose and improve this? I've already watched your videos on abdominal pressure syndrome and elevated the head of my bed and avoiding acidic fruits and legumes as they worsen my symptoms.
Okay, well, this sounds like, I'm a manifestation of abdominal pressure syndrome. So lack of dietary fiber earlier in life. I know he's a vegan now, and leading to constipation, defecation, Valsalva maneuver, increased abdominal pressure, straining at defecation because you're defecating hard stool, goat pellets or hard Tootsie Rolls rather than a cow patty, so to speak. Normally, fiber pulls water into the stool. Your stool's a little more bulky. It stretches the rectum. That rectal stretch causes a reflex contraction, and defecation's effortless. If you're popping out goat pellets and hard, dry Tootsie Rolls because your stool is small because you don't eat enough dietary fiber to pull liquid into the stool, chronic straining at defecation, it's called the Valsalva maneuver, causes back pressure on the stomach. Stomach pops into the chest, part of the stomach, the top of it, called a hiatal hernia. And this also weakens the lower esophageal sphincter connecting the esophagus to the stomach. So you get reflux of stomach acid into the lower esophagus. That can be very painful. The characteristic description of the pain is called heartburn. And it's typically in medical terms called GERD, G-E-R-D, gastroesophageal reflux disease. Okay, so what can you do for it? First of all, you can avoid the foods that tend to make it worse, which tend to be spicy foods, like you mentioned, citrus. People sometimes have their own idiosyncratic foods that tend to bother it. Things like onions, tomatoes, radishes, all that kind of stuff. Really hot food can sometimes bother it. So you got to kind of work out for yourself through an elimination diet what tends to bother it. And you can do things like, stay upright for a couple hours after you're eating, because if you lay down, you might reflux more. As soon as you lay down to sleep, you should lay right side down because the stomach empties to the right, and that helps to get the food to just drain out into the small bowel and not reflux back up into the esophagus. Dr. McDougall had a good essay about this. It's called "My Stomach's on Fire and I Can't Put It Out." It's all about gastroesophageal reflux, and he goes through all the foods that are known to make it worse, goes through all the medications that can loosen up the lower esophageal sphincter. There's medicines, opioids can do it. I think beta blockers can do it. Benadryl can do it. And there's a couple other ones. So you certainly want to make sure you're avoiding all of those. There's other things that can irritate the stomach too. So you're going to work through that as a diet and stuff, and then keep a high fiber diet so you don't get any progression of abdominal pressure syndrome. Those are things that could help.
Is that article on Dr. McDougall's website?
Yeah, drmcdougall.com. It'll be that article, "My Stomach's on Fire and I Can't Put It Out," is what it was called. It's like a newsletter.
So can you please talk about soy and hormone-positive breast cancer? Been vegetarian over 30 years. Since childhood, switched to vegan 10 years ago. Was diagnosed de novo stage 4 breast cancer in my early 40s. A shock, a slim, active, non-drinking, healthy vegan. Always been a big soy eater. And all other doctors say to eat soy and flax for living longer with breast cancer. After watching your videos last few weeks, I'm questioning this. Can you speak specifically to studies that show estrogen in soy somehow blocks the estrogen receptors and acts protective, reducing circulating estrogen? Doing my own experiments, I've noticed since quitting soy, I have more low estrogen symptoms, which has made me further question the popular studies related to soy not acting as estrogen for cancer patients.
Any food product that has a big profitable budget, it always gets these corporations to publish a bunch of papers exaggerating its benefits. It's like that old quote, I think, from Churchill in the 1940s, "A bodyguard of lies," okay, to get everybody to ingest the stuff. And there's even papers written by people who work for these soy popularization groups that will say soy has no estrogenic side effects. Yeah, right. Go back and look at the old papers, and you will see papers about soy causing premature puberty. Go back and look at the papers about soy estrogen receptor activation. And you'll hear on the internet, oh, it only activates the good estrogen receptor. I think that's the beta. That's, helps prevent osteoporosis. It doesn't activate the bad estrogen receptor that has these estrogenic effects like proliferation of breast cells and uterine endometrial cells. And I'm like, yeah, I guess, again, look at it a little more closely. It caused activation of both of them, all right? So it does have estrogenic effects, okay? There's actually a biochemist. His name is Anthony J. And a lot of people in the vegan community, they don't like him because he doesn't know much about nutrition. He hangs out with the paleo, keto, carnivore guys. That is true. And maybe it's because he needs the money. They got a lot more views than the low-fat vegans do. Okay, but what I'm trying to tell you is the guy's smart. He wrote a book called Estrogen Generation. And he went through a lot of these problems with soy. I went back through all the papers. It caused deformities of the reproductive tract, premature puberty. It's goitrogenic. The non-organic stuff's processed this a lot of times with hexane, which is a major neurotoxin. Okay, it's very high in fat. It's really high in protein. There were other problems with it too. It's sometimes concentrated toxic stuff from the soil. I forget specifically if that was aluminum or what, but bottom line, I would never eat it. And then the papers on what is its effect towards cancer were equivocal. Some said it's protective. Some said it worsens the risk. Others said they just can't tell. So either way, it certainly doesn't sound. Usually a negative paper on a food is more reliable than a positive paper. So anyways, I think if you look into it in more detail, you'll avoid soy. I would never eat soy.
Great. Okay. Any recommendations for reversing chronic sinusitis with nasal polyps? I have had several surgeries, but they always come back. I found an elimination diet helps, particularly avoiding gluten, sugar, and its derivatives. Typically clears me up within 3 weeks. If I stick with the diet long enough, could I potentially kill off the root cause?
Well, you might. I mean, that sounds like a good idea, the elimination diet. Dairy is also kind of famous for thickening the secretions of the nasal passages and causing stuffiness. So I would certainly avoid all dairy. And I would keep on working towards those things. But I would also ask yourself, you reach a point of diminishing returns with sinus surgery. How much sinus surgery do you want to have? And every time you do a sinus surgery, there's a risk of a complication. So a little nasal stuffiness, if it's not causing you any problems, you might want to just live with it. And I also say that because I look at, many thousands of sinus CTs, brain MRIs, and I almost never see an aggressive sinusitis invading the brain. Have I ever seen it? Yeah, but it's super rare. And I see tons and tons of patients with nasal polyposis and sinus surgery. So what I'm trying to say is, it depends on your own individual context, but if you can find things are livable and your last CT didn't show a high risk of something invading the brain, like sphenoid sinusitis, eroding through the bone, which I virtually never see, or a frontal sinusitis eroding through the posterior bone, then I would just, try to find yourself what minimizes your symptoms, and I would just go with that. I would be a little cautious about doing too many surgeries because, you run the risk, like I said, of having a complication.
Okay. Any advice for achieving PMS relief as a 35-year-old female? I've had excruciating periods my whole life. Last year did a 5-day water fast. During my period, surprisingly, had no pain. I'm following a no oil plant-exclusive diet, but can't figure out how to deal with pain without NSAIDs or birth control. Could high-fiber meals be causing abdominal pressure contributing to pain? Should I consider doing the rice diet or extended fast to get to the root cause?
Okay, so that's a little bit interesting, PMS relief, all right, in a premenopausal woman. So a couple of things that are interesting. Neil Bernard wrote a very good book some years ago, I don't know, 5 years ago or something like that, called Your Body in Balance, all about hormones. And he talked about a lot of women, their PMS symptoms go away when they minimize their exposure to estrogen. So the main thing being talked about in that book would be the estrogens in foods. Like we said, if you eat non-organic cattle or drink milk nowadays, they have the cows genetically engineered to produce milk while they're pregnant. Pregnant animal has high estrogens. You get more estrogen. So I would recommend no dairy at all, none whatsoever. Nothing from an animal. That's number one. Number two, you got to filter your water. It's too expensive to remove the estrogenics, which can be removed with carbon filtration for a municipal water filtration company to do that. So you have to filter your own water. At a minimum, have a carbon filter in your house. I'd recommend even having a carbon filter for your whole house, reverse osmosis for your kitchen. Okay, and then also I would recommend avoiding all the personal care estrogens. No dishwasher detergent, no laundry detergent, no perfumes, no colognes, no deodorants. You want to avoid all these estrogenic chemicals. You find estrogen in almost all of these chemicals because it's a good preservative, has good shelf life stability from the aromatic ring, the benzene ring. It's got good antimicrobial properties, good anti-mold, antifungal from the hydroxyl group on the benzene. A benzene with a hydroxyl group is called a phenol. All right. Bisphenol A, the plastic, is 2 phenols. So I would avoid all of these things as much as you can to minimize your estrogenic exposures. And there's a good chance your PMS will go away. I can tell you, my girlfriend, when she started going out with me, on our first date, she says, am I going to have to become a vegan if I go out with you? I said, you're going to have to eat vegan when you're with me. You're going to have to cook for me. Otherwise, I'm not going to date you. And anyways, I'm laughing is because pretty soon after that, she's like, She says, your vegan diet stuff, she said, she had hives on her body. She said that went away. And then she said her PMS went away. So, it's a small sample set there, but that's just another example from real life. And also, he talked about it, Bernard, in his book, that the Japanese women, when they eat the old-fashioned low-fat plant diets, they go through menopause and nothing would change except their period. They didn't have any symptoms in their menopause.
All right. So here's a couple of questions. This is, have you heard of the X39 LifeWave patch? Can you explain the science? Do you know what that is?
I don't know the science of it. I went to the website and looked at it one time. They didn't say a single useful thing, just a bunch of emotional buzzwords. Enjoy your life, all this type of stuff, rather than saying this is what it does. So I don't know. I don't know the product.
All right, and then above that is nutritional yeast healthy?
Yeah, we already talked about that. No, yeah. I wouldn't.
Why do I get gastritis from fruits?
Oh, that almost sounds like a troll. Don't eat the fruit that bothers you, okay?
All right. Seeking expertise in diagnosing and managing leaky gut, could you recommend the most reliable diagnostic test to confirm this condition? Additionally, I read conflicting information about dietary approaches. Would a low-fat diet? Of course, you've got a whole talk on this on the autoimmune talk you just gave.
Yeah. It's kind of a big topic. We go into a lot of detail on the autoimmune talk, and a lot of times focus on curing yourself rather than paying for some expensive tests. There are some tests for it, but yeah, I'll let that one go.
Okay, all right. What have we got here? At different times, Dr. Rogers says he eats one meal a day and also eats hundreds of grams of fiber a day. Did he mean he does this at the same time? If so, how's that possible?
Okay, now I used to eat twice a day. In my old lifestyle, it was better for me for a while to eat twice a day. And I would eat this giant thing of oatmeal with tons of blueberries on it. And I was getting tons and tons of fiber. And I didn't have that much rice. And I was eating lots of beans because the persons who cooked for me at that time cooked that way. As of now, I'm eating more rice. And rice is a little lower in fiber. So I haven't recalculated my dietary fiber, but I got tons of fiber. I get a lot of it because, I exercise a lot. So I got tons of fiber. It's not an issue for me. And my potassium is off the charts. Potassium, I don't know my exact ratio, my K-factor ratio. I'd have to recalculate it. I'm not worried about it. All I can say is I eat some foods that are like 100-to-1 in their K-factor amount of potassium to sodium. So it's a non-issue. And I still get tons of fiber. I eat tons of plant foods. And I eat a lot, I'm a pretty athletic guy. I weigh about 163. I'm 5'9". So that's good size for me. Anyways, it works.
Should people reduce their oxalate consumption by heavily restricting higher oxalate foods like oranges, kiwis, tomatoes, certain berries like raspberries, potatoes, sweet potatoes to avoid forming kidney stones? This is basically on eating a low fat, lower protein, whole plant food. Should I try to find information about oxalate content and be worried about it?
Yeah, this is another one of those lectins and oxalates and carbohydrates. Oh my. Yeah, right. Oh my God. Don't be afraid of all the patients that are fat, sick, and stupid with hypertension, diabetes, and coronary artery disease and cerebral vascular disease. Instead, we got to worry about lectins. Dr. McDougall said all this stuff about lectins and oxalates, it's totally exaggerated. I look at a lot of stone formers, okay? I used to put in tons of kidney drainage tubes for kidney stone patients and help out with percutaneous nephrolithotomies. And I can tell you, almost all of my stone patients have fatty liver. Where does fatty liver come from? It comes from these high-fat diets. It doesn't come from plant diets. I don't see a lot of skinny vegans with health problems.
Yeah. Okay. Is this the same person? Are gluten, whole grains like organic rye, wheat, and barley and its products, rolled wheat, bulgur, rolled rye, and rolled barley, good starch staples to eat every day, or are they too high in fat and protein?
They're not that high in fat and protein, and most people are not that gluten sensitive, but some people are. So if you're gluten sensitive, then you should have to avoid those. And also, if you're going to eat those things, you probably want to eat them organic, because if they're non-organic, they're more likely to spray glyphosate on there, and a lot of people are glyphosate sensitive. So that's the trade-off there.
Hi, Dr. Rogers. Fat loss is the goal. I'm focusing on foods that fall below 10% fat, like potatoes, rice, fruit, vegetables. Does it matter if more than half my carb intake comes from fruit? Would it be better to focus on starches, or does it matter for fat loss?
Yeah, a lot of fruits are low in fat, and as long as you can handle it fine, and you can see how your weight is, okay? But some people, they tend to overeat the fruits and they might gain weight. So you got to see for yourself how that goes for you.
Yeah, I think I agree. Are iodine supplements okay as a replacement for iodized salt to ensure adequate iodine intake? After all, they supplement salt with iodine anyways. What's your, and then the second question, opinion on vitamin D supplementation year-round in cold climates?
Okay, well, first of all, with the iodine, you don't automatically need to supplement with iodine. This iodine hypothyroidism came from the idea of a goiter belt. People used to only eat the food that grew in their backyard, in the family farm, so to speak. And if they were in an area where you had low iodine soils, like a goiter belt, you might become deficient in iodine. But nowadays, most people buy their food at a grocery store, and it comes from all over the world, and they get plenty of iodine. Most common causes of hypothyroidism nowadays are autoimmune diseases like sequela of Hashimoto's, for example, and Graves' disease. Okay, so I wouldn't supplement with iodine unless I had a problem on my thyroid function tests and my energy was really poor for those reasons. I wouldn't randomly do it. And I'm not a big fan of all these salts. If I was going to use salt, I would use iodized salt. I would also look into the study about microplastic. A lot of salt has high plastics in it. I don't know if that information will be available, but I would try to find it.
Okay, here's one. What's the connection between leaky gut syndrome and heart disease?
Oh, yeah. Well, leaky gut's going to increase your heart disease. You're going to get all this amyloid clotting. Trust me, look up Douglas Cal, PhD from England, and look up Etheresia Pretorius. She's a PhD lady from South Africa. They're partners. They've done a lot of great work on amyloid clotting in the blood. And I think it is a very important thing that's under-recognized. Iron overload also contributes to it. You'll find it interesting. So leaky gut does contribute. Leaky gut also is the main cause of autoimmune disease. Autoimmune diseases are prothrombotic. Look at lupus, for example, anticardiolipin antibody, okay? Very prothrombotic, all right? So, yeah, you don't want leaky gut. It's bad. And you better take good care of your teeth, too, because you can get the same problem coming from your mouth. Bacteria from your mouth can get into your blood if you don't take good care of your teeth.
Okay, here's a question from someone who says he's interested in trying your plant-based protocol. I have a question including animal-derived foods. If we source products that are raised naturally without hormones, antibiotics, free grazing on grass, exposed to sunlight, and so on, what's your opinion? What's the downside?
Well, the so-called grass-fed organic life of an animal is better than the modern CAFO, concentrated animal feeding organization, feedlot type of place. But it's still meat. Meat intrinsically is always going to be, there's no carbohydrate in meat other than in milk has some lactose, okay? So it's always going to be high in fat and saturated fat, which is very atherogenic, raises your LDL cholesterol, and it also causes insulin resistance, increasing your risk of diabetes, and they both increase your risk of atherosclerosis. So meat is not a health food, okay? I realize that people, when they survived in northern climates and they didn't have any food in the winter, it was nice to have cattle so they didn't starve to death. But in the modern world, we're lucky enough to have grocery stores, and they can keep things, greens and starches and all the stuff more available. Starches pretty much preserve well through the winter. But what I'm trying to say is you don't need to eat meat at all. It's not a health food. We don't need it at all. So I would recommend, if you want to optimize your health, don't eat any meat, zero. I'm 100% vegan. That's what I think is the healthiest diet.
Okay, here's someone talking about Brian Johnson again, the guy spending millions not to die. He's getting 40% of his diet from nuts, seeds, and olive oil, not to mention 25% of his protein, and so on. So what do you think of this guy? You've already said.
we already covered it. I think it's nonsense.
Yeah, since starchy foods, salads, and fruits are low in calories, what would be the best calorie-dense food to include if someone's struggling to eat enough? Would it be something like honey, white sugar, nut butter? We talked about this a little bit before too. Dried fruits, breads. We covered it. The high calorie stuff, certainly not tahini or olive oil. What causes elevated ferritin?
Well, iron overload. Okay, some people can have hemochromatosis. This person says their tests were negative, but you get iron overload if you're eating a lot of the meats, especially like red meat, like your beef, for example. You'll also get iron overloaded from all these processed foods because they fortify almost all of them with iron. And that's how I got iron overloaded when I was younger. I wasn't iron overloaded. My serum ferritin was still in the so-called normal range, but it was not in the ideal range. The normal range, I forget what it is, something like below 380 or something, but the ideal range is 30 to 80. So that's why I did those therapeutic phlebotomy, and I get a minor therapeutic phlebotomy every time I go for a blood test, for checking my serum ferritin or my total cholesterol or my vitamin B12 or one of my other labs. And I find that helping me. Oh, another interesting thing is I notice when I sweat like on my collar, I get like a little bit of iron. So you can sweat out some iron. Not that much, but you can sweat out some. That's one way to get iron out of your body, a benefit of exercise. And that'll also help to lower your serum ferritin. Make sure you got a water filter, especially if you got well water. It can have a lot of iron in it. You'll see it because it'll stain your sink and the floor in your shower. And so you can get an iron filter to remove that from your well water to some extent.
Great. Okay, here's somebody who's 75, whole food plant-based diet for the last 15 years. Weight dropped from 160 to 145 15 years ago. He's 5'11", still very high metabolism, exercise every day. If he does not eat nuts, avocados, use good olive oil, eat other healthy fats, his weight will drop down to 135 and he'll be hungry all the time. He talks about the Berkeley Heart Lab test 12 years ago indicated 35% fat, a long way from Estlund's recommended 9% fat diet. So
it sounds like a troll.
Yeah.
I mean, the guy was like real tall, and he's saying he weighs 135 pounds, and oh, the poor thing, we're not letting him eat fat. Give me a break, okay?
He's
I see one fat, sick, and cognitively slow patient after another, and they're all hypertensive, diabetic, with coronary artery disease and cerebral vascular disease, okay? And so all of a sudden, like I said, the incidence of disease on the internet is like the opposite of it in the real world. In the real world, oh, I'm starving on the vegan diet. Can I please have some fat? Can I please have some olive oil and omega-3? Give me a break.
Okay, so here's someone talking about, Peter Rogers, do you know anything about amalaki powder?
No, I'm not familiar with it, and I don't take any powder foods. They're pretty processed, and I worry about heavy metals. In Consumer Reports and some other articles and some other papers, one after another powder food had heavy metals in it. So I'm real skeptical of powder foods. And my attitude would be, why take a chance? I don't need that stuff. Why risk, ingesting high amounts of heavy metals?
So someone asking if you have a favorite brand of B12.
No, I just get the fewest ingredients and no stevia.
Is nori seaweed safe because of how toxic the ocean is?
I wouldn't trust anything like that from the ocean. I mean, what for? They're probably taking it because they want iodine or omega-3s, and I'm like, I wouldn't worry about those things, so I wouldn't mess with it.
I wouldn't eat that nori. Question on thyroid health. If someone is on levothyroxine, what does Cytomel do as an adjunct medicine?
Yeah, so the usual thing is T4, like Synthroid. Cytomel is like the T3 thyroid hormone, but it's a little trickier. It has a short half-life. You're more at risk for rebound hypothyroid effects. You also can more easily overdose it. It's more powerful, more potent, and it could cause atrial fibrillation, other arrhythmias. So you really want to go to somebody who's very experienced in prescribing thyroid medications to help you get all that stuff adjusted. And in the background, I would make sure you're avoiding everything else that can inhibit thyroid function. If you still have some intrinsic thyroid function, all the halogens, filtering your water, for example, avoiding bromines in pool water or fire retardant gowns and all that other stuff. So I avoid everything that's goitrogenic, the goitrogenic foods, cruciferous vegetables, soy and all that, the flax, for example.
Great. Here's one. Many people refer to the great cholesterol myth, why lowering your cholesterol won't prevent heart disease, by Stephen Sinatra, MD, as a reason to keep some fats in your diet. If Nelson or Rogers could comment on the content of the book, I haven't read it.
The great cholesterol myth is the myth of the paleo keto carnivore community that cholesterol doesn't cause heart disease. The real cholesterol story is there's mountains of data that shows that it increases your risk of coronary artery disease and myocardial infarction, okay? And, Gregory Sloop showed that the LDL cholesterol elevation was a bridging molecule to stick the red blood cells together, causing blood sludge rouleau formation, okay? Chylomicrons cause blood sludge. Roy Swank wrote a lot about that. We know that triglycerides also cause blood sludge, sticking together the red blood cells. So all of those things predispose to clotting. A clot is what atherosclerosis is. Cholesterol is definitely a very significant risk factor. And it's mostly the saturated fat, but all the fats are atherogenic. I've gone through all this stuff before. David Blankenhorn's papers, Dr. McDougall interviewed him on TV. Any fat you eat, MUFA, PUFA, sat fat, they're all about the same estrogenic in terms of causing atherosclerotic plaque. They're all found in the atherosclerotic plaques. And whatever study they did, the African green monkey studies, the rodent studies, the Riddell studies, they all found they were similar in their amount of atherogenesis. So they all should be avoided, minimized.
Good. I think maybe just a couple more questions here. 72-year-old man, very active physically, SOS plant-based. My skin, however, very dry and thinning, does not look or feel healthy. I surmise as an elder, I'm slowly losing capillaric blood flow to the surface of my skin. What can I do rapidly?
Yeah, we already did this one.
We talked about. What standard of care in cancer surgeries now implies removing some of the lymph nodes close to the affected area besides just degrading the cancer? What good is it going to do for the patient? Isn't that a procedure will only rob him of the main defense our body has against health problems, the lymphatic system?
Okay, so this is a couple things all at once here. So basically, if you read, Dr. McDougall did very extensive study of breast cancer. And after studying that for decades and going through all the literature on it, it was that just a lumpectomy was the best thing to do and not do a lymph node dissection. That you got equivalent results of doing a mastectomy or an axillary lymph node resection, okay? You need your immune system to remove the cancer cells from your body. There's also two different main theories of cancer. There's what's called the somatic mutation theory, the SMT, that some type of mutation happens to the DNA and then the cell becomes cancerous. All right, and conventional medicine mostly goes by the somatic mutation theory, which tends to imply both a centripetal spread from the initial primary tumor outward and into the adjacent lymphatics, but there's also a component of potentially hematological spread through the veins far distant in the body. And what McDougall says in his extensive study of the subject is that cancer almost always, by the time it gets to be a centimeter, it's already spread metastatic throughout the body, a real cancer that could potentially kill the patient. So he says it's always going to come down to a systemic contest to control the cancer growth, and you need your immune system to do that. And that's why he also felt only a localized surgery for control of the primary tumor was useful and that there was no point in going after the lymphatics. He felt that wasn't going to change the prognosis anyways. You already knew the patient had metastatic disease, so taking out the lymph node wasn't going to change what you were going to do anyways. Typically, the surgery is considered therapy for the primary tumor as it first arises, and then the chemotherapy is a systemic therapy, meaning it goes throughout the body to treat the metastatic disease. One of the points Dr. McDougall would make is eating a low-fat, vegan plant-based diet helps to get your immune system to function well and give these patients a better prognosis. Sort of the most famous patient from the low-fat McDougall diet was Ruth Heidrich. Okay, she did very well when she ate the McDougall diet. She was diagnosed with breast cancer in her 40s. She's still alive. She had her 90th birthday recently. So what I'm trying to say is, do I think he should take out the lymph node or not? I'm not going to get in the middle of your surgeon's decision, but I can also tell you in surgery and conventional medicine, tradition dies hard. Okay, it's very hard to get anybody to change anything. And protocols tend to become established and they tend to become the standard of care. And most doctors want to follow the standard of care because if they follow the standard of care, they can't be sued, they meet the requirements of the billing codes, they get paid. There's almost no reward in conventional medicine for innovation. You innovate, you might deviate from the standard of care. You might not get paid. You might get sued, and they'll say you didn't follow the standard of care. So why deviate? If the patient dies, there's no consequence for that. You can't be sued. You don't get paid anything different. So what I'm trying to say is it's not based on patient outcomes. It's based on tradition and standard of care. So, me personally, it would depend on the cancer. It would depend on the context and all that stuff. But I do think McDougall is right when he's talking about the horse is already out of the barn by the time you can see it on a CAT scan or an MRI in most circumstances, meaning that it's a centimeter or larger before it's confirmable on a PET scan, for example. It's typically a centimeter or larger. And so you probably already got metastatic disease. So you need your immune system. And you got to look it up real carefully. Should you take chemo? Yes or no? Should you have surgery? Yes or no? Don't just assume it works, because a lot of times that's what's recommended just because, when all you've got is a hammer, everything looks like a nail. Is what I'm trying to say is all they ever use in conventional medicine is surgery, chemotherapy, and radiation. That's it. So more cancers get pushed into that treatment routine, I think, than is necessary. And, this is a whole long topic. I could talk about this for hours, but you got to make sure, what are you dealing with? Are you dealing with a turtle, a rabbit, or a vulture? And that's the old story of if you owned a farm with 100 square miles with a central enclosure and you had vultures, rabbits, and turtles in there. Now, they're fenced in, totally enclosed. If there's a break in the roof and the vulture gets out, he's going to fly over the fence, your 100 miles away fence, kill the patient before you can screen for it. You can do anything. You can't do anything about a vulture, but vultures almost never happen. Okay. The next cancer is a rabbit. He digs underneath the fence and he makes a run for it, going for the 100 miles away fence. And you want to stop the rabbit, surgery, chemo, radiation. That's what everybody thinks cancer is. But the other reality is most cancers are actually turtles. And if somebody forgot to close the gate on the central enclosing area, they wouldn't even make it to the fence if you went away for vacation for 3 weeks or 3 years. Okay, what I'm trying to say is try to know what you're dealing with cancer, but, you know, I'm not going to get into all this stuff because it's a controversial subject and it goes on for hours and hours, but look up McDougall's lecture on it. I would leave you with that. And look up Ruth Heidrich.
Beautiful. All right, I think this is gonna be the last one for today. I have a heart conduction problem for about 7 years. I've had high blood pressure that does not go down on a plant-based diet. I was also taking too much levothyroxine for 2.5 to 3 months as my TSH was 0.01, 0.2 respectively. The cardiologist said that those two things caused the heart conduction problem. I'm on 12.5 milligrams of Metropol twice a day and alternate between 50 and 75 micrograms of levothyroxine in the morning. TSH went up to 3.23 at 50. My blood pressure measures higher in doctor's offices up to 160/70 and measures high in cold weather at home. Also don't sleep well consistently. 70-year-old female. Any suggestions? Not overweight and exercise, maybe a little oil, sugar, salt. Had low sodium on blood tests last 2 times, cholesterol 147. So there you go.
All right. Yeah. I mean, that's basically a pretty concentrated question. It's like 10 questions in one. Minimize your atherogenic hypertensive risk factors, and, you know, work with your doctor on control of your thyroid condition. And that's about the best I could tell you. You know, they're complicated with a lot of rock between a hard place, that little parameters in there.
All right. Since that wasn't much of an answer, we're going to go a little more. What's your opinion on using HRT as a means to prevent osteoporosis postmenopausal women?
Yeah, we kind of covered that one as well, that the osteoporosis incidence is overrated. The Bantus who just exercise and don't have hardly any calcium are fine. I wouldn't jump to HRT like we talked about. It's more estrogenic than you think, potentially increasing the risk of breast cancer.
You call that disease mongering, the osteoporosis stuff. Okay. Male, current 60, 5'11", 150, was 220 in 2018 when diagnosed with left side heart enlargement, HCM with syncope, postprandial hypotension, hypertension, macros 85, and so on, refused open heart surgery and beta blockers, difficult to exercise. Is there anything else you would do to lessen syncope after eating? Have passed out twice. Is HCM genetic? No one else in family has this.
Okay, but I don't know if this is a troll question either, though, because, I mean, look what he says. He's got hypertrophic cardiomyopathy with syncope postprandial. So after he eats, he faints, and his blood pressure is either too high or too low. You know, what am I going to do with that? Okay.
This is strange, and I don't even know what happens.
Yeah, talk to your cardiologist, your echocardiographer, and figure out maybe subtype your cardiomyopathy more accurately and figure out what they can do for you. Because that question was full of pitfalls and tricks.
Do fatty bloodstreams damage heart valves and cause AFib?
Yeah, you're going to plug up your arteries. If you're eating high-fat diets, you're going to plug up the arteries of your heart, and that can give you atrial fibrillation. And there's all the other things. We kind of talked about them earlier that can cause atrial fibrillation as well. Alcohol, caffeine, sleep deprivation, stress, you know.
Have you watched the health lectures of Walter Veith?
I've heard of him. I've seen a little bit of him. That was kind of nice from the 1990s, but I don't really know his work. I don't know him in that much detail.
Are oatmeal and oats good for us? Or are they too high in fats to eat a lot of each day?
They're not bad. They're in the ballpark of around 15% fat, which is not bad, but I would definitely get them organic, because if they're not organic, they're spraying glyphosate on them probably. Dr.
Rogers' opinion on getting a mouthful of series of dental x-rays every 5 years. Dental oral health, excellent. I'm vigilant about my oral care. My dental screening radiographs fall in the same category as unnecessary so-called preventive screenings. What's your thought?
I'm not a big believer in screenings. You know, take care of your teeth. Why are you going every 5 years for x-rays? So you help your dentist to make money? If you take care of your teeth, you probably never have a problem. I haven't been to a dentist in 28 years. I just take care of my teeth. I got all my teeth. So you avoid sweets, you avoid carbonated beverages, you clean your teeth every night. Because, when you get an x-ray, you get a little bit of radiation exposure to your brain. The machines are better than they used to be, but there's still going to be some radiation exposure to your brain. If you got dental amalgams, you're going to get a scatter effect, more radiation exposure to your brain. If you have a kid, you send the poor kid for dental x-rays every year or every 5 years even, you're adding up radiation exposure to their brain. I wouldn't do that. And I know how it is. A dental institution, some of them will say, well, to prevent fraud, we must have an x-ray confirmation of the cavity. And the dentist will use that as an excuse to x-ray the kid every, whatever interval for screening. Let's say it's 5 years. That's still a lot of x-rays on a young kid going into his brain. And I'm not a big fan of that.
Okay. All right. Well, I think we're going to cut it here at this point. Huge thanks to you, Dr. Rogers, for joining us again today and sharing your incredible knowledge. Every time we do one of these Q&As, I walk away with, new insights and a deeper understanding of how to protect and optimize health. And I know a lot of people watching this feel the same way. So if you found this helpful, please be sure to give it a like, share it with someone who needs to hear it, drop a comment below with your thoughts or with more questions. We are definitely going to be doing this again. This is popular. We're getting more questions than Dr. Rogers can answer, even in 2.5 hours or whatever it's been. Thanks again for watching. And thank you, Peter, again, for being so generous with your time and your brain power. And I'll see you on the next one.
Thanks.
All right, thanks. Whoops.